Half a day, good morning. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Friday, October 8th, 2021. The time is 9:04 a.m. Notices for this hearing were disseminated via email to all senators and all main media broadcasting outlets on Friday, October 1, and again on Wednesday, October 6, 2021, in conformance with the Open Government Law. The notice was also published in the Guam Daily Post on Friday, October 1, and again on Wednesday, October 6, 2021. The Zoom meeting is hosted by the legislature's AV staff. I thank them for their assistance. The host will mute all Zoom participants until called upon by the chair. Individuals testifying shall first be recognized by the chair before speaking and begin by stating your name on the record. So when we transcribe it, it will be very easy for us to remember who was speaking at that time. Senators will be allowed to ask questions following each item on our agenda. We have 3 agenda items this morning. The first is the informational briefing. The Department of Public Health has been asked to inform us on financial resources, health care, and legal assistance available for foster care parents, and our efforts to assist them with informing the public and recruiting foster parents in light of the great need of foster parents today. Second on our agenda will be Bill number 41-36 COR, introduced by myself, Therese Terlaje, an act to amend section 4210 of chapter 4, title 19, Guam Code annotated, relative to expediting social studies and reports for adoptions. The third item on our agenda will be Bill number 179-36 LS, introduced by Senator Terlaje, Senator Sabina Flores Perez, Senator Joanne Brown, and Senator Therese Terlaje. It is an act to add a new section 13510 to Article 5, Chapter 13, Title 19, Guam Code annotated, relative to requiring rules and regulations for the licensure of adoption agencies. I'd like to acknowledge this morning the presence of my colleagues, beginning with Senator Terlaje, Situs Masi for being here, and Senator Mary Torres. Thank you, senators, for being here. So now we will begin. Before we hear testimony on the bills, we have invited the Department of Public Health and Social Services to provide information on the financial resources, the healthcare resources, legal resources available for foster care parents on our island. If you are an individual or family considering becoming a foster parent or know someone who is or could be, we invite you to share this broadcast with them. It will be uploaded to YouTube following hearing. In May of this year, CPS reported that there were nearly 450 children in Guam's foster care system. Of those, 380 are in relative or non-relative placement and other programs. At that time, there were only 40 licensed foster care homes and only 72 children in licensed foster care homes. Today's informational briefing is an effort to assist with the public health's ongoing campaign to raise awareness of the critical need for licensed foster homes on our island and provide information on available resources to help encourage families and individuals to open their hearts and their homes to provide a safe, healthy, and loving family environment for many of our children in desperate need. With us here today is Deputy Director Terry Uggan from the Department of Public Health and Social Services, and his team from Public Health, and I want to thank all of them for being here. And after Public Health's presentation, we will also hear from Saina Rufina Tainatongo, who I've invited. She has been a foster parent on Guam for over 40 years. For over 4 decades, Saina Rufina has helped rear more than 80 children on top of her own. In 2018, she decided to stop accepting new children to concentrate on the children she was fostering long-term, but because of the great need and her great heart has again taken in more children. Saina Rufina, it is an honor to have you here with us today. Thank you for joining us on Zoom. I know it's a little bit different, but it's an honor to have you here to share your experience with fostering Guam's children and to hear any insight that you have to offer to those who may be considering becoming foster parents and to encourage others to consider it. We will now hear from the Department of Public Health and Social Services. If you can, please begin by updating us on the current number of children in the foster care system, the number of licensed foster care homes, the number of children awaiting foster placement, and of course, all your efforts. And I want to thank you all for your continued efforts to meet the needs of the children of Guam. So Deputy Uggan, I know you will be introducing your team as you go along. Sizus Mas.
Sizus Mas, and thank you very much, Honorable Speaker Therese Terlaje, and of course, Senator Mary Torres and Senator Terlaje. It's an honor to speak before you today and the people of Guam and to share information regarding foster care here on our island. I have a wonderful team that's presenting with myself. Once more, I am Terry Uggan, Deputy Director of the Department of Public Health and Social Services. And I do have Tess Archangel. I'd like her to go ahead and introduce herself as well. And while we're waiting for Tess to introduce herself, why don't I go ahead and have Corinne go ahead and introduce herself.
Hi, good morning. My name is Maria Therese Archangel, Chief Administrator for the Division of Public Welfare.
Very good. Cor?
For the Division of Public Welfare.
Corinne?
Good morning. My name is Corinne Tyron Bendicho, and I am currently the Acting Human Services Program Administrator here at the Bureau of Social Services Administration. Happy to be here.
And we also have Mayfei.
Good morning. My name is Mayfei Moiko. I am the supervisor for the Home Evaluation Placement Service section here at the Bureau of Social Services Administration.
Okay. Along with us today, too, we have Tommy Tidegre, who is the ASO for the Department of Public Health and Social Services. And before we begin, I really want to recognize and honor Mrs. Tayontongo, also known as Mrs. T. And I had the good fortune when I came on board with Public Health back in 1985, actually to be one of the many that have licensed her through the years. I was one of the first to actually license her when she joined the Department of Public Health and Social Services as an already ongoing foster parent here on this island. So with that, Tess, I'd like to turn it over to you for your PowerPoint presentation.
Hi, good morning, everybody. I'm here to provide some information.
Just a minute, Tess. I can't hear you. Just 1 minute.
Oh, okay.
Okay, there. All right, there. That sounds good now. Thank you. Please proceed.
I'm here. I'm attending this virtual meeting for this public hearing to provide some information briefing regarding
Tess, can I ask you
Yes.
to speak closer to the microphone? We've had this
Okay.
problem before.
Sorry,
It's always
this-
good when you close the microphone.
I always have a problem with regards to this computer. So can you see the PowerPoint presentation? Can everybody see it? No?
No.
Okay, wait. Can you see it?
No.
Let me just, I don't know why.
We see your name though.
Right. Let me just,
We got
There
it.
it is. Got it now.
can you see it? Okay. Bureau of Social Services Administration, Public Welfare, and Public Welfare under Department of Public. Bosa administers various child welfare.
Tess. This is
You cannot hear me?
you're going in and out. So you're gonna have to, sorry, remain close to that microphone. Yeah.
Okay, all right, okay. Bosa administers various child welfare programs designed to ensure safety and well-being of children and their families. Services provided are funded and regulated primarily by federal government under Title 20 and applicable local laws such as Public Law 20-209. The mission is to protect the children and strengthen the families. The next slide provides historical staffing of Bosa from fiscal year 2018 to fiscal year 2021. As you can see, the total number of staff in fiscal year 2018 to 2021, it went down. So in 2018, it's roughly at 75%, and then it went down to 66% in fiscal year 2019 and 2020. Currently, we are at almost 74%. That is because of our limited term appointments, as well as some staff from DYA. Bosa consists of 5 sections that includes Child Protective Services, which includes crisis or intake unit, investigation, and case management. Then we have Family Services section that includes Support Services Unit and the Family Preservation Program. We also have Home Evaluation and Placement Services section that handles the child care facilities and family foster homes and adoption and custody studies. Additionally, we have Program Management section that handles the policy and procedures, monitoring and evaluation, training and development, and fiscal operations. Also, under Bosa is the Administration Services section unit that maintains files, procurement, administrative, and other clerical support. The total number of referrals received in fiscal year 2018 to fiscal year 2021, as you can see, there is a decrease on total number of referrals and the total number of children involved. That is because, we can say it's because of COVID, because majority of the referrals we receive is from school. Our focus is on adoption, guardianship, and child custody studies in this hearing, which is under the HEPS section. This particular unit conducts individual and family assessment for adoption, guardianship, and child custody to ensure that each child is placed in a suitable home, safe, and that the child's needs are being met. This particular slide shows the requests received for studies. As you can see, from fiscal year 2018, there's also a reduction based on fiscal year 2021. This is also because of COVID and because of kids are also not in school. The next slide shows is an information regarding foster children health insurance. The insurance is Select Care for this fiscal year. The total number of children enrolled is 460 currently. The premium per month is $338.81. So per month, it's $155,852. If you're going to average it at 150,000 per month, we would need 1.8 million. Medicaid is another insurance of these foster children, which covers 100% of medically necessary services, all annual physical examination or early periodic screening, diagnostics, treatment services. This slide shows the fiscal year 2022 budget appropriation and current funding level, which includes the federal funding. So foster care health insurance premium is $665,396. Based on the previous slide, we stated that it's $300 per child. And so it would require roughly $150,000 per month, which will equate to 1.8 million per year. As you can see, there is not enough funding for that foster care health insurance premium. Then we have also a CPS funding, which is provided also based on the budget law. which is 114,068, which we can utilize to hire more people, but probably on a limited term. And we have foster care group home funding, 760,453. Foster care payment is only 374,115. That equates only to 1 month payment for our foster parent as well as a contract. And then Title 20 is 1.1 million. Total for budget for this fiscal year is 3 million. For FY22, the estimated additional budget required for foster health insurance is 1.1 million. And then for foster care payment is 4 million, which equates to 5.2 million additional budget required for Bosa. That's the end of the presentation.
Thank you, Tess. And Mayfei, can you talk a little bit about what the licensing process is if somebody was interested in becoming a foster parent, a little bit of information about what that process would look like?
Good morning, everyone, and thank you very much. I am here to speak about what it takes to become a licensed foster parent, and we are in much need of it at this current time. So when an individual or couple, family member would call the Bureau of Social Services Administration, we basically inform them about the process. We submit, we provide them with a social questionnaire. We inform them that it tends to get intimidated because we ask a lot of information when it comes to getting applications so we could clear them. So they have to, one of the application process is answering the social questionnaire. We will do what do you call that? We require them to get a police and court clearance, as well as
Hey, here
what do you call
also,
it?
your audio is going in and out. If you could, try to keep it stable.
Okay, is this better?
Yes.
Okay, so when a person applies to become a foster parent, we give them an application, and in the application, it entails a social questionnaire. We require them to get court clearance, a police clearance. We have them do a consent of disclosure because we ask them to do a CAN background check, which is a child abuse neglect background check here in our office. We also, in the event that they have not lived here on island, we do a National Crime Information Center check for individuals who have not lived on island for 5 years. If they are in the military, we also do a background check with them. When we do the police and court clearance, we ask for police and court clearance for all the adult household in the home. We ask them to do a medical clearance, financial clearance, and 3 letters of references. And we therefore, we will interview them, do a home assessment and so forth, and license them with the number of children that they are capable of being licensed for.
Thank you so much. And I know a key part of today's presentation is really talking about what services would be available for families that are interested in becoming a foster parent, what services are available to children, and what supports are out there for foster parents after they're licensed and have a child in the home. And so I know with Mayfei and her vast experience, and of course, Corinne, who's on board with us from the Department of Youth Affairs, we have a lot of experience, but we do have Mrs. T, who's joining us today, one of our oldest, if not our oldest foster parent. And if you don't mind, Mrs. T, if you can say a couple of words about being a foster parent and what that's meant to you, it would be most appreciated if you are able to do so. I'm afraid I don't have everybody on the screen, but if you can chime in, that would be great.
Just a minute. We need to unmute you, Mrs. Tainatongo. Just 1 second.
Right.
There you go.
Okay. When my husband and I first become foster parents, there's a lot of work. Building inspector, land inspector, health inspector, all kinds of inspector, even fire department. Now it's so easy. All you need is police clearance and court clearance and reference from people that you know can testify about how you are. It's very easy now. And I'm talking to so many young adults that I'm asking if they're interested. But you know, all of you, Therese is one of the first caseworker that bring the first child to my house. And that was how long ago. And I'm still here with children in my house. I was talking to myself when the speaker called me about 8 o'clock. And I'm asking myself, what will happen to all these foster children if no one wants to be a foster parent? It's very rewarding if you really, it's from your heart if you have the children with you. It has to be from your heart. And treat them nicely. I'll talk about my husband when he told me to accept the children. I'm the mother. But he made me promise not to get angry at the kids and say, these children are as bad as their parents because they don't know why they're there. So I kept that promise that my husband asked me to promise not to say it to the children. And no matter how angry, he doesn't want me to use the word mad. Mad is like killing the children. But he said, if you're angry, talk to them nicely. It is very rewarding if you really know how to handle the children. You handle them more, you treat them more than your very own. You treat them like your grandchildren because grandchildren are so loving. And they come first. Grandchildren comes first to you other than them, the immediate parents. So you treat those children like your grandchildren. They're so loving at the end and you will appreciate what you have done to them because they appreciate you. I have one in my hand that she's 9 years together with me. And I am very proud of that girl. She's so appreciated. And I told her to be the leader of these 3 children that I have. Oh, I know Corinne is the one that came with 2 children. And I said, I don't accept anymore. But then in my heart, I said, okay, Corinne, come, bring them over. Next day, 2 more days, another worker is Orlean, Minnesota, and she said, we need a home for this boy because the foster parents are leaving. And they are the sibling. He is the sibling of the 2 sisters that I have. And according to my license long time ago, I'll take children with their siblings if they need to be with me. But I tried so hard not to take someone that will prevent me from going to church. And these children that I have right now are so loving children. They are. And my heart cries if they leave me. But all I want the children to do for me, I don't want any award. All I want for them to remember me. And one of them, a long, long time ago, I was at Kmart coming in and the young lad said, hi, Mom. I said, maybe because of my age, he called me Mom. But he followed me in the Kmart until I come to the door and said, you don't remember me? I said, no, I don't remember you. Who are you? And when he told me who he is, that's when I remember him. And that's one good thing a child remembers, how you treat them. If you treat them cruelty, they won't remember you. They won't even think of you, but treat them from your heart. So all those that are interested in becoming a foster parent, it's not hard now. And I think, correct me if I'm wrong, most of our foster parents are in the military. That's, I know. So Guamanian people, grandchildren, young adults that are married and don't have children, open your heart. That might bring you out your own child if you take one. All they're asking is one, but then you started out with one, and go ahead, me and laugh at me. You started with one, you and Terry then come with 5, then 6, but I don't refuse the children. At one time, I have a set of 6 bunk bed because the inspectors will come to your house and measure how distance are the children when they're laying down. Those were hard things, but I didn't back up. Now they don't do that. All you need is police clearance, court clearance, and your house suitable for a child with love from your heart. That's all the Bosa people are asking. Open your heart. I tried to shut it, but Corinne said, open it, and I did. So now I have 3 children. The total of children with document that came to my door, even there's one with only 30 minutes, but document is 91 together with these 3 children that I have. 91 children all together with legal documents. But if you are interested in becoming a foster mother or foster parents, and it's from your heart, you will not regret. You will not regret it. So that's all I'm asking for the public to open their hearts. But when I see all those documents or what was showing about money, it costs a lot for the CPS children, foster children. I have a suggestion if you will listen and appreciate it. We have buildings that are not used anymore. Remember, we used to have children at Cottage Home and up at DYA Sanctuary. We can have those buildings rented by the government or fix it up by the government and put the children and hire the people like the hospital, where they have nurse from 7 to 3 and 3 to 12 and 12 to 7 with others. And that will save, I think to myself, that will save the government money. That's a lot of money that I'm seeing. The document that was showing, that's a lot. But if you are, open up your heart, people, if you're listening, if you are interested from your heart, we need foster parents. And you start out with one, and then you will see if you really to be a foster mother for the rest of the days that you can be able to treat children, take care of children. That's all I have to say.
Mrs. T, thank you so much. And
Thank you, Terry. I miss you. I miss you coming to my house. I miss you coming to my house with children. And
you
so
know,
as
I'm sitting here and I'm watching you and my mind goes racing back to the day where I said her hair was jet black. And she's so loving and so wonderful with the kids. And she really has a gift with the teenagers. And you're truly an asset, not only to foster care, but to the community.
I protect those children. I do protect them at my house. And guess what? I line up containers to my window so that if someone tried to come in or break through, I can hear it. 3 times at night when they're sleeping, I get up and check on them to see if they're okay. The boy in his room, he's okay. The girls in the other room, they're okay. I check on them 3 times at night.
Yeah.
Make sure that they are safe because those are government's property, not mine. The children that I have, foster children, are government's property, and I have to take care of them, and that's what I'm doing.
Where you are truly a watchful angel over the children, and I know through the years you've gotten up many a time throughout the night to make sure that they're safe, that they're okay, and that they're not sad. So I really do appreciate it, and thank you so much. Please, 40 more years.
Thank you, Terry. I miss you coming to my house with children.
I need to just come by and visit. Thank you. So I do know that a good portion of today's conversation, the briefing part, is to also talk a little bit about the services that are out there for families. And, you know, there is a stipend to help foster parents to, you know, pay for some of the items that children, of course, need, you know, groceries and so forth. And, you know, children are not, their placement is not free in the sense that that the money is a token money. It's money that's actually sort of a reimbursement. But if you're newborn through 11 years of age, the monthly stipend is $576.73. And if you have a child from 12 to 17, through 17 years of age, it's $779.43. So again, we know that costs can vary greatly from child to child, but we know that this money is there to help the foster parent, having room for the child, making sure that the family is in a good place to be able to provide for the child without taking away from other children in the home or taking away from their own children, of course, is always very important. The system also has set up through what we call the Child Care Development Block Grant, Child Care Services actually for foster children. And this is a service where a foster parent can actually enroll their child into child care nursery to benefit from the socialization that a child can have. And we do have foster parents that engage in that. And of course, if there's any foster parents that are listening and they're not familiar with the program, or their caseworker provided some information, but they'd like a little bit more information, please, by all means, contact us at the Department of Public Health and just ask for Mayfair. And of course, our number is 475-2653. But again, this has to do with the Child Care Development Block Grant. Our children are also entitled to Wic Services. Of course, that's for many of our younger children. And for those that are not familiar with this, it is under the Department of Public Health, USDA, and it is a nutritional program. And so they provide for items like formulas, or even some smaller items like cheeses and brown rice and bread and so forth like that. And that program is very much used here on Guam, and our foster parents can avail of that service. Our children also receive a very small token clothing allowance a year. I'm afraid for newborn to 11 years of age, it's a little over $202. And for children that are 12 through 17 years of age, it's $290. So again, this is a very small pocket of money. We know that you can do a shopping spree for children and burn out that money very, very quickly. And fortunately, through the years, we've had programs that have assisted with children's uniforms. And so we know that's a big help, not having to pay for a lot of those items. To continue on, our children do qualify for the free meal program at school. And that's usually a breakfast or lunch program serving nutritional foods that are also USDA approved. It's simply working with your caseworker and making sure that information is available to our foster parents. As Tess mentioned, our children are covered for medical insurance. And currently our primary insurance program is Select Care. However, our secondary insurance is the Medicaid program. And Medicaid has evolved to a very good place, actually, where they cover quite a number of items that, just in case Select Care doesn't cover it. And the idea is that between the two insurances, that foster parents should be able to get the medical care and the services that they need around perhaps a surgical procedure or eyeglasses, annual physical checkups, especially in preparation for enrollment into school, and all types of other services. So by all means, again, that number is 475-2653 for people who have questions regarding the services and benefits that these two insurance covers for our foster children. There is a category for dental insurance. I don't know, Tess, if you'd like to join in on me on dental insurance, because often our children that are abused and neglected, dental care is the last thing on the mind of the alleged perpetrator. And so it's important that especially because children coming to us often have concerns around oral hygiene. So Tess, which insurance covers that as well?
Actually, Select Care also covers dental. And at the same time, Medicaid covers medically
And just speak up close to
dental.
the microphone. 'Cause
I'm
you're in and
trying
out.
to. I guess I just have to remove mine so I can put my face near near the speaker. So I'm sorry about that. So Medicaid covers a comprehensive dental services. So any services for children, as long as it's necessary, we cover them. So, and at the
Very-
same time, it's also covered under Select Care. And we know if there's a limitation, Medicaid is always the insurance where they can go to. That's
Thank you,
100% covered. Okay.
Thank you. It's important that foster parents, as they enter into the system, and we have a number that are not as seasoned as Mrs. T, but new ones that are coming into the system that hopefully will be with us for a number of years. But as we license, as we onboard more of our foster homes, the team in partnership with the Director of Department of Youth Affairs, Lonnie Williams-Brennan, is working on a listing, a vision of trainings that should be available to foster parents. And we know areas such as pediatric CPR is an excellent training for anybody who has a child in the home. But just knowing perhaps how to diffuse a difficult situation or how to be more aware of the different challenges that perhaps as children get older or the years that they've been exposed to certain situations, that perhaps entering into the home, the different personalities that a child, of course, can bring with them, and the ideas that that the foster parent be equipped with the tools and the knowledge on how to work with children, to be patient with them. Very often, foster parents are so well-intended. They're excited about their first child. And guess what? Love is going to conquer all. But the truth of the matter is it will, and persistence will. But the truth of the matter is the more you can have a level of training and put that into practice, and to be able to have your resources and your backup, the better. And it puts foster parents in a much better place. And I do know that there is a foster parent actually chat group where they can reach out to each other as well. So it's important that the messaging be singular in the sense that we want to make sure that trainings are available, that the correct information is available to our foster parents, and of course, encourage that peer support that they get. And many of these things, Mrs. T, right, were not available when we were first doing licensing, but I'm happy to see that through technology, some of this has evolved, and foster parents being there for foster parents is very important, especially when you place either a behavioral concerned child or even a child with special health care needs. There is a document called the Universal Referral Form. It was developed a few years ago under a program called Project Cariño, which is an early childhood mental health program. And the Universal Referral Form, what it did is it collectively took a lot of the programs for children and placed them on one referral. And the vision, of course, is that foster parents should not have to repeat their story each time that they apply for different services, such as Guam Early Intervention Systems, which is newborn to 3, or Project Basita, which is actually a program for visiting home nurses and social workers to make the child's doing well. But the idea is that they can use as one form, put down the information once, and that form is actually copied and disseminated out to multiple agencies. And that really helps save time and footwork. Our foster parents are busy with foster children as well as their own children and running a household. And it's very difficult, of course, for them to just constantly go to different programs. So that clearly is a service, and it really is an excellent one that is out there for the community. I just want to ask Mayfei or Core if there's any, or even Tess, if there's any other services that you can think of that are out there for children that we should mention at this point. And Tess, just as a reminder, if you're going to say anything, please get very close to the microphone, and I think you're not. Cor and Mayfei, anything that you'd like to add to that list?
For services for children and for foster parents, well, first of all, we all, children below 3 years old, we do the universal referral for all our child serving agencies. But we try to give our support to our foster parents, such as our support group that we collaborate with some of our faith-based partners here on island. And we also I would, if they contact me, I would also email the foster parent handbook in advance so they can be aware of what it is like to be a foster parent and what it entails to be a foster parent. It's about over 100 pages long, so there's a lot of reading because they do have their duties as a foster parents as well. We collaborate with Harvest House on the last month of each on the last Thursday of each month to introduce or to give informative sessions on what it is to be a foster parent and what to expect. So we work closely with our faith-based partners, and I'm currently starting to work with the Mayor's Council as well to recruit foster parents.
Mayfei, thank you for that information. And can you take a moment for our listeners and viewers and just sort of state what is Harvest House?
Okay, Harvest House is one of our faith-based partners who is amazing. And one of the things that they do, I actually have, I see Miss Bethany Taylor from Harvest House, who, if she would like to explain, but we work with them. We most especially when we take children under protective custody, especially during emergencies, all hours of the night, Harvest House is there. They have a facility where we could take our children to take showers before we place them with homes that we place our children. They provide clothing. Some of our foster parents are not, as a foster parent, you could, in your application, you could put in the age that you would like to accept children in. Unfortunately, we have, even though you asked to have 0 to 5, I would call you if I have a child over 5, if you would take these children in. And Harvest House is there to provide materials, clothing, toiletries, even car seats to our foster parents who just accept a child and they don't have the items, and they help, when we first take them in, they take them a shower and, try to give them the peace of mind that everything is okay. And we work closely with them.
Thank you, Mayfei. And I do want to add too that when a child's placed in a foster home, and even though there is a monthly stipend, many of these families also may qualify for the SNAP program. And of course, the SNAP program is the Supplemental Nutrition Assistance Program, formerly known as food stamps. And so a lot of the energy and effort from our foster parents is just to make sure that a child is safe and loved, they're nurtured. Many of the things that they did not receive early on, of course, during those formative years. And really the last thing I would really want a foster parent to say, oh, I don't want to be a foster parent because I really, don't have the means to feed this child, even though my heart is saying otherwise. Please work with a caseworker, give us a call at the 475-2653 number. We can pre-assess for eligibility. We do it all the time, even before a person goes and applies for welfare services. And we can go ahead and take care of that as well to pre-screen just to see if it's worth applying for something like the SNAP program. But I don't want the issue around whether food in the house is going to actually deter somebody from being a foster parent. When public health brings to the table that resource, and we are more than happy to work with you. I think many people are a little bit in a position where they feel they shouldn't apply, and their personal incomes actually is something that they don't want to talk about. But, we will protect your privacy, just like we protect the privacy of the children and the families that we work with, would protect the privacy of our foster parents as well. And let's just look at eligibility and see what we can do to actually have a child placed in your home and without putting the burden or stress on a family. I will say this because a lot of our children come to us throughout the day and into the early morning hours, and many of them leave their home with the clothes on their back. And so partnering with programs like Harvest House and Catholic Social Services and other nonprofit organizations that are out there is very key to making sure that that the children have something. And many of them actually have clothes that we can get from them that are basically play clothes. And then of course, nicer clothes can come through other means, but just the daily around the house stuff. And many of these hockey clothing are kind of fun, and children can play in them and everything else. But my point being is that because children sort of come to us in a number of different circumstances, a lot of them do not come to us with a birth certificate, a social security card, or a shot record, or any other type of historical medical documentation or anything verifying really their existence. And so the Department of Public Health and Social Services is also in a very good place to be able to advocate for a birth certificate, especially if the child is born on island. And we have a system too about applying for Social Security cards to make sure that the child does have one, as this is something that, again, if they had remained in the home that they were in, the abusive home, isn't something that they probably would get, if they do get, anytime soon. And then of course the shot records, many diseases and so forth are very much preventable, especially around the early childhood ones, measles, mumps, rubella, so forth. And we just want to make sure that the children have that opportunity to grow up healthy and strong. And so that's available. And if people have any questions around that, I've offered the number. I'll offer it again. It's 475-2653. So right now, does anybody have any questions for our public health team and our DYA partners?
Yes.
Anything at all?
So yes, Deputy Director Uggan, could you just talk about give a little background on the types of foster care options that are currently available on Guam, including emergency, short-term, long-term, or full-time care, and then how do these individual home placements work in a system with other homes, like for example, the Sister Bridget's home up there in Vergara Heights, the Ollie Shelter for Children?
Right. Speaker, thank you for the question. I'm afraid you were a little in and out on my side as well. Would you mind repeating that, please?
Oh, yeah, sure. I wanted you to, if you could talk about the types of foster care options for families or individuals, including emergency, short-term, long-term, or full-time care, and how these individual home placements work together with a system that includes, we still have long care facilities such as the Ollie Shelter or the new Sister Bridget's home for children.
Sure. Of course, the really interesting thing about the HEPS program, the Home Evaluation and Placement section, is when we talk about foster care, and when I did my research a couple of days ago, we had 474 children actually in foster care. And a number of them actually are in licensed individual family homes. And that's ideal for some children. And then we have children, of course, in group homes, such as Ollie Shelter 2 under Catholic Social Services, as well as Sanctuary Incorporated. So those are your group home type of facilities. Years ago, we actually used to have a residential treatment facility here on our island, and we still do, but specifically it was for Gumamanhoban. And then we have other placements for children. It's true that we do have a beautiful shelter up in on Guam, and it is for the placement of children. Currently, that is undergoing the GSA process, and it has been a process. But the building it's standing. We have the appliances installed. It's beautifully equipped with the furniture and additional clothing that would be available for children. And we did temporarily stand it up under the Department of Public Health and Social Services government of Guam, just as a emergency receiving home, while we're waiting for the GSA process to continue and to be completed. So there's an array of different arenas for children to be placed into different types of living situations or housing situations. All of them monitored through the Department of Public Health and Social Services. We do also have a category for children who are actually in relative placement, and that's a rather large bulk of the cases. And I know Mayfei can chime in and give us a little bit of information about those numbers. But relative placement, you know, when a family or a child can go into a familiar environment, whether with auntie or uncle, which they have an ongoing relationship, then all the better. You know, I think those things are very important. And then we do have children that are also placed in court-approved homes that are currently actually going through the licensing process. And Mayfei once more can talk about those numbers. So of that 474, and actually if I were to check today, I'm sure that number might vary. But of the 474 that I had looked into a couple of days ago, all of them are either in group homes, individual foster homes, they're in relative placement, they're in court-approved homes that are currently going through the licensing process. And given those numbers, and I will take a moment to at least talk about some of the referrals that do come in, and only because in my most creative mind, I can't even begin to tell you that if you didn't read the referral, you really could not even begin to imagine the types of horrors that many of these children have gone through. And they're so young. And you think, you know, this 3-year-old, this 6-year-old has gone through a lifetime of trauma and pain that many of us will never endure for our entire lives. And so when that child actually is placed in a home, it is an adjustment period. You know, as a foster parent myself, I know with one of my children, you know, that child had difficulty sleeping on a bed, you know, and I'll never forget, you know, getting up in the middle of the night like Mrs. T and wanting to check and make sure everything is okay. You know, you always want to check and make sure everybody's breathing and everybody's good and they're sleeping well. Just to find the child not on the bed, but sleeping literally in the corner of the room in an infant position, but pitched against the wall, as if they're either ready to run at a moment's notice or ready to run if they get hit. It's just amazing. I mean, these children have really conditioned themselves to have to respond to the abuse and neglect that has occurred to them. And, you know, for families that are interested in foster parenting, and I always say love will conquer all, but the reality is many of these children do need an adjustment period, and they need to have the assurance that food will be on the table, that they won't have to beg or plead for a bite to eat, that they won't have to be hit just because they walked in the door because their shoes were wet, or whatever the case may be. And clearly the referrals are quite heinous. And if anything, through the years, we just have such a large number of substance abusing parents. And that's something that, you know, that when we first licensed Mrs. T, we did have some of that. I remember we had a meth house in one of the villages, and not far from public health for that matter. And it was present in our community in the 80s, but it has grown considerably through the years. And it's to the point where, you know, every person either can think of somebody who has a substance abusing problem or knows of somebody whose family member has a substance abusing problem. It's really saturated into our community. So, you know, kudos to programs, departments like Guam Behavioral Health and Wellness Center, and all those that are trying to secure a level of treatment for these people. And for those that have been patient with our families as well, because they go to the court system And then either they're a no-show, no-show. They finally get into the system and they may get back into using substances. The courts really give a period of time before the child is actually put into a level of permanency for the parents to really prove themselves either to be able to care for this child or to clearly not be able to take care of this child. So it has been a process. So I hope that answers your question.
Yes, and can I just ask for some of the demographics? So your current 474 children, what would the demographics be? Ages, ethnic backgrounds?
Oh, absolutely. So I'll go ahead and give the floor over to Mayfei.
Good morning, all. So the 474 is actually from stats taken on October 5th. Okay, I'm unable to do the demographics on the gender, the ages, and so forth. I apologize for that. But the 474 out of all, we have children, we have 70 children in a licensed foster home. We have children with relative placement who there's 242. We also have children, as Terry has said, that we work with parents and they're still under our system. So there's 49 of our children who are back with their parents, but they're still under our protective custody because we're working with these parents. And we have 77 children in homes approved by CPS.
All right, thank you. I'd like to acknowledge that Senator Brown has also joined us this morning. Senator, thank you. And I know that the senators all have questions, but I wanted as part of this to also acknowledge the community support services that you receive and the partners that you have. And I know we have Harvest House and the Kate Thomas Foundation, the Guam Foster Families Association. We also have Catholic Social Services. And I want to acknowledge Guam Homeless Coalition for their role in us also assisting public health and its role in trying to assist these children. And if there are others, if you could please recognize them, help us recognize them this morning. And all of their work to try to close the gaps. So we talked a little bit about, government support services, but we have to recognize that a lot of these support services are coming at this time from private or nonprofit support services.
Yes.
Mayfei, are there any that I missed?
I think you have it all. Thank you.
Yeah.
Oh, we're currently working. We just started currently working with the Mayor's Council to try to recruit foster.
Yeah, so I was going to acknowledge the Mayor's Gift of Family campaign, and they've launched the goal of finding at least 19 foster families, and that number I think comes from the number of villages. So they want to find at least 19 families by Christmas. According to the Mayor's Council President, Mayor Jesse Alec, the campaign is to encourage each mayor to recruit at least 2 families or individuals interested in fostering to attend an informational meeting that will be arranged in November. And they will do similar things, give them the guidelines for fostering, opportunities, benefits, share experiences, offer encouragements, and hopefully lead to a Christmas event where they can feature the newly recruited foster parents. They will be announcing the dates of these events, but I also want to acknowledge the continuous work done by our individual foster parents and also Harvest House and all our partners in continuing to help us to, on a continuing basis, recruit foster parents. I'm going to open it up now for my colleagues. I know that they might have questions, and just to keep in mind, so we will, after this informational briefing, move on to the hearing on 2 bills that, and we have a full agenda this morning. But Mrs. Tonga, I want to thank you, especially for encouraging the younger people to take up foster care and sharing your experience, and also I know that there is a great need, and I know that the resources haven't always been consistent for foster families, and that foster families have really made it work on their own. And so we are with Tess and the division and, the Bureau and the entire department trying to ensure that we can shore up the services and make them very consistent for those who take on this commitment. All right, so I'll now open it up. We have 3 senators present, Senator Taitegui, Senator Torres, and Senator Brown. So we will begin with Senator Taitegui.
Thank you, Madam Speaker, and thank you to everyone who's here today to talk about something very important and dear to my heart. As a member of the Regalu board, I see the progress that's being made, especially from public health and what they're doing to assist those. And Mayfei, I remember the first time meeting you was at a carnival during Liberation, and you had all the foster children out there, and we're all giving out tickets to them. And now seeing that you're moving toward the mayor's, I did attend the mayor's meetings. And I'm just so happy and proud that that work is moving into that direction, because one of the questions I do have is, do you have any funding that's been appropriated to you, Mayfei, with regards to, the outreach programs and encouraging other foster parents? Is there any funding for you?
For our foster parents, I don't do the financial, I'm not outreach.
Yeah.
Back many years ago, we worked with a lot of community partners, and a lot of the community would invite our foster children. And of course, when we do bring our children to these outings, such as the carnivals, and there were also plays that our foster children were invited, we have to make sure that they keep their anonymity. And we encourage our foster parents, just like a sense of support. There used to be little plays down in Southern High that I remember bringing our foster parents. Of course, the carnival, when it was real active during the summer, we were offered little tokens or tickets for our foster kids that we provided them. Harvest House, they do a great back to school program every year. Other activities, even during Christmas and so forth. So our foster children are invited to many activities when the island was open, not much so now, but prior to 2020, there was a lot of activities that our foster children were invited to.
So I guess what I'm kind of asking for is any funding that's available to put outreach programs like advertisement on TV, in newspapers, on encouraging to be a foster parent. Funding like that, Mayfei, that not so much, I know there's a lot of donations that have been giving to the CPS and the foster care division at Public Health on donations, but within the department and agencies, to do a reach out program, advertisement, that costs money, that's the kind of funding I was asking if you had any that's been set aside for that.
I'm going to defer it to Tess.
Okay, yes, Senator, we do have.
Okay, Tess, I didn't hear you. Try again.
Sorry, I really have to put my face again. Yes, we do have something for those under Title 20. We utilize those, yeah. And if we have some extra money, local money, we can utilize that too.
Okay, so I guess, okay. I've never heard you guys looking for any additional funding with regards to that respective. So I'm just wondering to ensure that if you do need the funding, because one of my concerns is during the budget hearing, and we asked if there was any additional funding needed, we gave what was asked for. And I think there was some anticipation of using ARP funding your way to counteract what you didn't get in this budget. So that was an understanding. But after looking at the insurance premiums that was presented to us, where an additional 1.13460 is needed for insurance premiums, that's very alarming. You're looking at 460 foster children, it looks like enrolled, and of a premium of 338, which gives you a monthly of $150,852 per month. And with a 12-month, of course, I'm doing the math here. It's obvious that all you have set aside in the current budget is 665,396, when the number is actually more 1.8 million 231.20. So that's a huge difference. And is there any way you're going to find any funding? Is there funding in the agency to cover this premium, and also the foster care payment and contact? Can you kind of explain that?
Senator Taitigui, if I may, and yeah, I don't think we have time this morning for a budget hearing. And we were assured by Public Health that they acknowledged that they were short in certain areas of the department's funding, and that they were going to be covered in any shortfalls that they had by the governor. That was their representation at the budget hearing.
Okay, that shortfall is about $5.2 million. That's quite a bit. So, and if we have that commitment from the governor, then it's greatly appreciated, because that's very alarming and concerning with regards to that. So, again, other than that, the outreach program we talked about, the foster home in Barragata Heights. Terry, how soon will you have that up and running? I know you're going through the GSA program, working with them, but how soon?
Can you hear me okay? Because you can hear me?
Yeah, I can hear you okay, Terry. You've been
I'm sorry. Our sound is a little bit in and out, so I just want to make sure. Okay. I hope actually it's very soon. I mean, we have children that definitely could benefit from the placement in the facility. I do know that if the process takes much longer and we have to stand it up again as a government placement or facility ran, that we will do so. The idea is that we just need to get it used for the purpose in which it was built. And it is, like I said, beautifully appointed. It has the necessary items, the stoves, the refrigerators, the wash machines, the beds, and a huge thank you, of course, to Regalo and the former First Lady for really moving that project along. And I actually do apologize too, because I thought we were talking about the benefits provided by public health, but I definitely don't want to sell short any of our community-based organizations and the wonderful support that they give to our children, because there are numerous ones that have given generously, such as the Sugar Plum Tree Project and the Lions Clubs and Harvest House, and of course Catholic Social Services and so forth. But to answer your question, Senator, we will work closer with GSA. We continue to put a lot of energy into it, but if we need to stand it up again, we will. We did have children placed there for a few weeks. It worked out beautifully. The thing is the idea is not to take away more time from Bosa staff, the Child Protective Services staff, to be putting in shifts up at that facility. And when it first was sort of launched with the idea that we may have to do that, everybody was very excited, and there was such a willingness, and there still is. But, to do that, and then, to use your weekends or your after hours to be able to be there for a few hours and to watch children, it too in itself, you leave there, you go home, you decompress, and then you come back again and you're right in the middle of an investigation, and then you're doing an evening shift there at the shelter. So you really want to make sure that we don't take advantage of the staff, that we keep them in a good mental place, that they are effective at doing their jobs. And the idea is that we just need to work through this process.
Terry, can there be volunteers to go up to the foster care home in Barragata Heights when you do have children in that situation? Like a foster parent, they come into their home, but is there any possibility of being a volunteer to go up to the Barragata Heights facility and be there to man there for a certain amount of hours?
Yes, the idea actually is that the shelter itself is, its location is not one that we actually publicize. It is very similar to the women's shelter for Catholic Social Services for abused and battered women. Its location is kept very private. I think it would be wonderful if we could have volunteers, but that really is the obstacle right there. And even a volunteer, of course, we want them to get the proper police clearances and so forth. Okay. But that would be the concern. And if we're able to work with that concern, And normally that would have to be somebody who we know and trust and have a history with, perhaps a foster parent that is no longer a foster parent, but we have that history with them. We might be able to put something like that into play. I'm never saying no. I'm just saying that we need to make sure that we keep the confidentiality around the shelter to where it needs to be.
Okay, thank you, Terry. Madam Chair, thank you so much. And I ask that, maybe that be an option to provide an avenue for individuals who want to volunteer in that situation, especially with those other areas that are temporary shelters that we can be a part of and help. Thank you, Madam Chair.
Thank you very much.
I will say, Senator, that if it is stood up by the government, then I'm sure we will recruit and we'll train people there that we can monitor and we'll work with. I actually would love to see, volunteers coming in from the community and reading stories to the children, doing arts and crafts with the children, just doing some of the things that children deserve to do. And that would be my vision. But thank you for the question.
Thank you very much. I want to, this hearing today, I know there are so many topics that we can cover, but we're trying to just focus today on recruitment of foster families or parents, foster parents, and the resources that we can provide them. There was a question on the chat as to, is there a formal training when a person becomes a foster parent? I know you're trying to give them information in advance, and that you've mentioned today during this hearing that DYA is also partnering with you to come up with for different types of formal training for different types of subject matter. But would you describe it as that there is a formal training program available, Mayfei, for those who agree to become a foster parent?
At this current time, we are working really hard and trying to create these foster training. I've collaborated with Harvest House and how we could maintain our current licensed foster parents and to also recruit foster parents. So I encourage anyone interested in becoming a licensed foster parents or to attend the information session that Harvest House provides each last Thursday of each month at 6:30. We try to meet face to face. We also we've been doing Zoom, but now we're trying to do face to face. If anyone would like information regarding becoming a foster parent, I can provide a foster parent handbook. But I have spoken and with Harvest House, with Miss Bethany, and they have great ideas on how we could train or what it needs to be, how we can train prospective foster parents and current foster parents.
Right. Thank you. Now, Senator Torres, thank you for your patience. You have the floor.
Thank you. In the interest of time, and I just want to express Ndunklunis Aduas Maasi to you, Terry, Corrine, Mayfei, and Tess, for this very informative briefing. And Mrs. Tainatongo, you are godsend. God bless you for all that you do. Thank you, Madam Chair.
Thank you very much, Senator. Senator Brown.
Thank you.
Thank you very much, Madam Chair. I understand time's short. I just wanted to ask a question, certainly with regards to the children. And I know, Madam Chair, at another time, we can probably get into more of the details, but I understand the need for foster families and what's been expressed, but I also think that maybe some of the hesitancy from some people who probably would very much like to open their home, it's the emotional attachment and the fear that, they're there to support and take care of this child. And you know how we are in Guam, we take the child in as if it's our own. And then of course the fear of losing the child. And understandable, you want to place these children back in their primary homes. But I wanted to ask, what is the length of time that a child can be left in the foster care system? And is there a time frame where parents are given the opportunity, whatever their circumstance may be, that their child is taken away, to address that? So a child is not for years, from maybe one foster family to another. Do we have a time frame that we determine after a certain period that if that family support is not there, that child can be adopted into a home that can provide the support and emotional and physical care that child needs to grow. Because we can't put these children in suspended animation until parents get their act together. And I know Terry and company, all of you've worked in these circumstances for many years and have seen so many different situations. There might not be a one size fits all, but that's one of the things I'm very curious about, because I think that's probably something that might, make people hesitant to want to get into foster care, not because they don't care or want to help these children, but they fear losing them. Before they even get them, they fear the emotion of losing these children and wanting to be that parent to support these kids.
Senator, thank you for your question. And, I will say this, on the licensing side, as a previous worker with CPS, if we all had the mindset that this child is one day going to be removed from us, then these children will never have the opportunity of knowing what a well-functional, loving home really looks like. And that can make the world of difference in this child's life. And I will say this, I have pictures of the foster children that I have. I actually keep it right on my nightstand, and it's part of my nightly prayers, that those prayers follow these children wherever they go. And even though I too must admit that I'm saddened by the fact that these children are not in my life today on a daily basis, that what I was able to offer this child hopefully is something that they can walk away with and take with them until they become adults. And so Mayfei, I'll let you elaborate on this, but I will say, just really look at the fact that although it does cut deep into your heart when children are removed, what a difference you have made in that child's life, even for that period of time that you were there for that child. And I always say, jump and the net will appear. And the peace of mind that I have is knowing that at least I was able to be there for this child during that time and to show them, encouragement, positive outcomes, and to accept them unconditionally, regardless of their behaviors or whatever the case may be. It really, not only that, but seriously, those children have helped me grow tremendously. They've helped me on so many levels that it's another discussion for another time. But the children give to us as foster parents just as well. And they teach us so much, just based, I hate to say, on their past history and the different experiences that they've had. We all have lessons to learn, and it's a two-way street. And for foster parents that are people that are hesitant, who are interested in becoming a foster parent but are hesitant because of the pain of losing a child, you never lose that child. That child is with you through your daily routine, and you are with that child regardless if they are physically in your home. I really recommend for people to reach out and be a foster parent and take that chance and make a difference in a child's life. Mayfei?
So Senator Brown, thank you for that question. Each case is different. Some of our foster children may only be in the system for a week, maybe 2 weeks, some long-term. The ultimate goal is for reunification. We work with these parents in order for them to, get the services that they need so they could get their children back. So it's approximately 18 months if parents are not able to work with us, CPS, or they haven't completed the services that they have to complete, then unfortunately we have to move forward because these children need permanency. So the goal is to work with these parents for approximately 18 months to 2 years before permanency is written and recommended. Some of the recommendation is long-term foster parents, guardianship, or adoption. So, a foster child could be with our foster parents for maybe 1 week while the investigation happens, and we realize we could return the kids back to the parents. Months, it could be 2-3 months. They need to go through parenting classes or drug assessment or whatever services on how they got into our system. The ultimate goal for us is to always work with these parents and to always reunify these kids with their parents.
Well, thank you very much. Again, I know time is short, but thank you for all that you do. And certainly to Ms. Tina Tongo. I mean, if she could keep all 91 children, she'd need a very, very big house. But no doubt, I mean, she's let us know that her heart is even bigger. So thank you for your input. I'm sure our speaker will hold other forums to further discuss these issues and bring them to light within our community. With that, Madam Speaker, thank you very much for the opportunity to ask questions.
Thank you very much, Senator Brown. Again, I wanted to thank everyone from Public Health. One of the reasons I invited Mrs. Tina Tongo in particular, when I know we have very many foster families, and we would like to recognize all of them. But her in particular is because there was a statistic I saw in May 2021 that showed that the majority of children who were in the foster care system were Chamorro. And I thought that was something very remarkable about our community that prides itself on, taking very good care of its children. And as Mrs. Tina Tongo said earlier, that's not necessarily the same demographic for foster families, right? For foster parents. And so I do appreciate that she also tried to encourage Chamorro families to open their homes. And I think that is very important. And Mrs. Tina Tongo, I know you want to say something before we conclude this briefing, if you would like. Please unmute.
Please, I thank Senator Brown for a message, but there is a program with CPS, a family visitation. So every now and then, the children that I have visit with their parents or the family, and I'm pretty sure Terry and Mayfair will understand, verify it, that there's a visitation for children and their families at CPS office. There's a family room there. And I always, as a mother with those children, they call me Nana. I always told them that I am not their mother, but I'll be their friends and help them, and not to forget their parents. And the things that I'm telling them, showing them to do, I said, your parents, make your parents be proud of you. So to other foster parents, we all know that when we have the children, we are attached. But there are times when we have to let go, and the children understand that. To Ms. Mayfair, I would like a booklet so I can share it with my neighbors if you can. That's all I have to say, and thank you all for having me here with you.
Si Diyos maasi, sign up.
Dumas.
Si Diyos maasi, Deputy Director Uggan, Mayfair, Corinne, Tess, Archangel, Tommy at DPHSS, and all of our community partners at Harvest House and throughout our community. Si Diyos maasi for all your assistance and care for the children of Guam. Thank you, Senators. That will conclude our informational briefing. And we will proceed with the 2 bill hearings that we have planned for this morning. So thank you again to all of you. Si Diyos maasi.
Thank you.
It would just take a 1 minute reset up. Just 1 minute. If the senators could please stay online. Hafaday, and welcome back to our public hearing this morning. We will resume with our agenda items, beginning with bill number 41-36 COR. This bill is introduced by myself, Therese Terlaje. It is an act to amend Section 4210 of Chapter 4, Title 19, Guam Code annotated relative to expediting social studies and reports for adoptions. As a sponsor, I would just briefly introduce the bill. This bill was introduced in January of this year upon receiving the troubling news that adoption home studies were not being conducted within the 60-day deadline to file a report to the court, and that the Bureau of Social Services was continuously requesting the courts for extension. As a result, the placement of children sometimes was delayed or just put in limbo for a while. It was during this time that we also learned of the number of case referrals to CPS, which prompted Executive Order 2021-02, that moved CPS from the Department of, that allowed the Department of Youth Affairs to assist the Department of Public Health and Social Services with these referrals. We understand that there is a continued ongoing recruitment for social workers for this division for CPS, and that they continue to have a shortage. However, that they continue to do ongoing hiring. It was also reported that requests for home studies made by off-island child welfare agencies to the home evaluation placement section of the Department of Public Health Social Services Bureau of Social Services Administrations were sometimes being denied. These off-island agencies were seeking to place children that were in the state's custody into permanent placement with a child's family member living on Guam before considering placement with non-family in that other state. All states require that families applying to adopt first complete a home study to determine eligibility and suitability. The home evaluation sections informed these off-island child welfare agencies that they were at the time short-staffed, having only 2 social workers conducting studies, and the priority was cases on Guam. This is just one example of what we had heard back then. And as I said, this bill was introduced in January, but since then we have been assured by CPS that and DYA, of course, the director there who has been working with CPS, that they have been able to hire retirees as authorized in the different budget laws, the last year's budget law and this year's budget law as well. That provision is continued to aid them in the home studies, and that the home studies were, since this matter was brought up, being conducted in a timely manner. And that, so I want to commend the CPS for that. So we will now accept testimony from Public Health on this bill 41-36.
Thank you, Senator. And I'm sorry, can you hear me?
Yes, I just wanted to recognize you, the Deputy Director of the Department of Public Health, Mr. Terry Uggan.
Right. Thank you, Speaker. I really appreciate it. And thank you to the team that's currently on. I didn't get a list of the names, but I do want to recognize previously Senator Terlaje, Senator Mary Torres, and my understanding is that Senator Joanne Brown was also on the last call, and they may still be on this call. So Hafaday and good morning. And good morning to all folks that are interested in the well-being of our children and making sure that they live long and healthy lives and safe environments. And I think that's really important. So I did prepare a statement regarding bill number 41-36, and I will go ahead and take this moment to read it. So please bear with me. I read better without my glasses. Buenas and Hafaday, Honorable Therese Terlaje, Speaker of the 36th Guam Legislature and the Committee on Health, Land, Justice, and Culture. Thank you for this opportunity to participate in the informational briefing as it pertains to the financial health care resource legislative assistance and foster care of parents. In addition, thank you for the opportunity to provide my testimony in support of Bill number 41-36, an act to amend subsection 4210 of Chapter 4, Title 19, Guam Code Annotated, relative to expediting social studies and reports for adoptions. My name is Therese, Deputy Director of the Department of Public Health and Social Services, overseeing the Division of Public Welfare and the Division of Senior Citizens, and in support of the department's efforts to mitigate the COVID-19 pandemic. The need to protect Guam's most vulnerable population, our children and our mononco, includes their placement in a loving and secure home environment. Regardless if it is temporary or long-term foster placement or the need to place a child in an adoptive home, both are governed by the fact that these children deserve an efficient, well-thought-out social study that supports positive outcomes for a successful placement. As a previous employee of the Department of Public Health and Social Services assigned to the Bureau of Social Services Administration, Child Protective Services, I am reminded of the many challenges that this Bureau faces on a daily basis regarding the number of referrals and the heinous complexity of child abuse and neglect cases referred for investigation. Through Executive Order 2021-02, relative to declaring an emergency regarding the operational state of Child Protective Services, advances have been made to onboard qualified workers to address these challenges. However, there is still much work to be done in order to address the demands placed on this Bureau to include the Home Evaluation Placement Services Section unit. As the unit tasked to conduct social studies for the purpose of aiding the court in making decisions regarding foster placement, adoption, and custody, it is imperative that this unit have the resources needed to complete this critical mission. HEPS, Home Evaluation and Placement Section, currently consists of 5 staff, which includes the unit supervisor, 3 social worker 3s, and 1 licensing officer who oversees the Child Care Development Block Grant. This small unit under the Bureau of Social Services Administration is responsible for the licensing of all group homes to include Sanctuary Incorporated, as well as Catholic Social Services Ali Shelter 2, which collectively houses 48 children and youth. In addition, the program is responsible for the licensing of family foster homes, which currently totals 41. The overall number of children in foster care as of October 5th, 2021 is 474 children, to include relative placement, Child Protective Services court-ordered and approved homes, and homes that are currently undergoing licensure. Bill number 41-36 may provide a path which will allow Bosa to enter into an agreement with individuals or organizations that have a current business license for the purpose of conducting social studies and/or reports for adoption. In addition, this bill or a similar one may also allow for additional assistance in the form of social studies for the licensing of family foster homes. And I say family foster homes as an addendum only because the current bill didn't cover them as well. Although intended for the different purposes, an adoption social study and a social study for the licensing of a foster home share key areas of interest. The study itself reflects a series of personal interviews that help answer questions as to whether the adoptive family can provide for the basic needs of the child, the social interaction of the adoptive family with their community, future securities, and family relationships to include extended family members. Many of these same questions are addressed in the home studies conducted for the purpose of foster placement. I am confident that Bill number 41-36 will be a tool for Bosa to develop, and one that will allow the department to better meet the timely deliverables of adoption studies without compromising the integrity of its content. Once more, thank you for this opportunity to speak on behalf of Bill number 41-36.
See, Zilsmasi, Mr. Uggan. We also have signed up to testify today, Lori Boss. Lori, please proceed.
Good morning, Madam Speaker, Senators, and committee members, as co-founder and executive director of Ohala Adoptions, Guam's first private nonprofit domestic adoption agency, and at the request of Speaker Terlaje, I submit this testimony in support of Bill 4136. Our passion for child and family welfare brought us to organize this nonprofit service in Guam, and we're focused on safe, healthy, and ethical placements for children to create permanent loving homes for them. To do this, the emphasis on the home study process cannot be overlooked. Home study reports are what a judge uses to determine whether to certify a family for adoption. The primary purpose of a home study is to ensure that each child is placed in a safe, nurturing home that's capable of providing stability and love for that child. In reference to subsection 4210A, home studies referred to in this bill as social studies, commonly in the states are referred to as home studies, are very involved, as has been mentioned. A comprehensive home study is a detailed report providing information regarding a family, their home, their lifestyle and personal histories, motivation for adoption, which is very important, the adoption preparation and readiness, their financial situation, their health and biographical information, police and court clearances, FBI background checks, personal and professional references, and physical home evaluation. During the home study process, a social worker or independent agency representative would get to know the prospective adopted family through the collected data, through letters of recommendation, home visits, and interviews. Guam law requires that all household members, regardless of age, must be included in this study, and those persons over 18 years old will need background checks. We'll also be providing the family with information and resources to ensure they're prepared for the challenges of adoptive parenting. In reference to subsection 4210B, at childwelfare.gov, we find the regulations for each state and territory. State laws and regulations specify the persons or entity who can conduct a home study that will be accepted by the court that will hear the adoption petition. In most states, the department or licensed child placing agency may be that entity. It varies state to state. For example, in 7 states, an agency or individual is qualified and approved by the health department to complete the assessment. In 10 states and the Northern Mariana Islands, a person designated by the court may conduct studies. Pre-approval is an important element in domestic agencies being able to conduct their own home studies following Guam guidelines. We feel strongly about the need for home studies to be started when people apply to be adoptive parents and not require a court order to begin them. This ensures the safety and security of every child, should a placement be needed quickly, and alleviates removal of a child resulting in multiple placements. Ohala Adoptions is capable of carrying out all components of the home study, and by doing so will not add to DPHSS's workload. We have a licensed social worker on staff. Each time a child and newborn infant moves from one home to another, they experience trauma, often resulting in attachment disorders. Multiple studies completed in the last 3 decades show that numerous placements negatively impact a child's ability to form emotional attachments and disrupts the child's ability to function behaviorally, emotionally, and developmentally. Home studies for adoptive families are more involved than home studies for foster care parents. These adoptive parents are not receiving a stipend from Guam as foster parents do either. They assume parental responsibility for a child from the moment of placement with the intent of permanency. Our understanding is that currently DPHSS begins an adoptive home study after a family petitions for adoption, meaning the child has already been placed in their home, possibly for many months. After placement, if a family does not meet the standards, the child must be moved. Pre-approval falls in line with current adoption requirements authored by Senator Therese from Bill 10836, where it stated that the baby has to be taken to a pre-approved home. It's important to make this change to be consistent with the new mandates. In reference to 4210I, all approved entities should conduct these studies to match with US standards, include all of Guam's requirements, and be audited annually by DPHSS or other approved government entities. We support Speaker Terlaje's proposed Bill 4136 to allow independent agencies or persons to be approved in Guam to conduct these home studies. This will allow us to pre-approve applicants for our own private agency adoptive family files and ensure the safety of the children being placed. We appreciate your time and consideration of the necessity of this bill. Thank you.
Thank you very much. We also have signed up Tracy Anderson. Tracy?
Day and good morning, Madam Speaker, senators, and committee members. All of you that are involved, excuse me, through the CPS and Bosa services, we're also grateful that you can be here today. When we were first made aware of this bill, we were then and are still very supportive of Senator Terlaje's actions to help with home studies to be done in a more concise way for the services of the island. As I look through the bill and I reference each line and page, I'm starting with page 1, line 5. It's indicated that the home study is assigned at the filing of the petition for adoption. As an agency that we will be working with families to meet all of the criteria required for adoption, we cannot wait until a petition is filed to perform a home study. The home study needs to be completed prior to any placement of a child into a home and family. This offers protection, security, and assurance that the home is safe and prepared to provide what is required for the care of the child. Also on page 1, line 6, it states that the division be the entity that will provide the home study. We propose that the new law be in alignment with other states' regulations, that state laws and regulations can specify the person or entity who can conduct a home study. Lori also stated in her statement that the courts can designate a person, the division can license specific individuals, and agencies can be determined to be licensed to provide the home study. Moving on to page 1, 7 through 9, denotes that an officer of the division has different requirements for presenting the home study to the courts. If other entities are allowed to do those home studies, there will be no conflict of interest in presenting home studies for no matter what person is being looked into.
I think your microphone turned off. If you could turn it back on.
Sorry, where should I start? I'll just start from where I was. Thank you for letting me know. When a home study is done prior to placement, all of the pertinent safety information has been covered, and the only need for recommendation would come from any home visits and evaluations of the family and child adoption. So I'm sorry, what I stuttered through there is that if the home study is done prior to placement, then the only recommendations that would have to change is if there was something discovered during post-placement visits. Everything would be safe and secure before the child goes in, and then post-placement visits would follow up on that. Whether we as an agency are allowed by courts or permitted by DPHSS, the authorization of different contractors, agencies, qualified individuals, it allows the division to oversee the home studies that are provided, that the agency can complete the home study, turn that home study into the proper division, the proper people at the division for acceptance and timely approval. Upon the formation of OHALA Adoptions, we began requesting any support and information to be able to work with CPS to do our own home studies with an agreement through an MOU or an MOA. With any kind of permission from public health, we would be happy to do our own home studies to be able to relieve them of that extra burden, not working with private adoptions. And also if they ever needed any extra help, we could help with their workload. At Ohio Adoption, we include the home study in our total cost of services. It is not something that we excessively charge for. It's not something that we're looking to make money on. It is just a means to provide the safety, security, and the priority of the home check before the infant is placed within a home. Minimum qualifications, as noted on page 2, lines 11 through 13, should be established and applied to any and all individuals and entities that place or assist in placement of any child. We hope that the qualifications and requirements set will be reasonably in line with the ability to meet the demands therein. And we ask that all agencies and individuals associated with placement of a child be monitored and held accountable for meeting the requirements. Thank you all for your time. We look forward to open communication and hopefully working together to make home studies easier to obtain. Thank you.
Thank you very much, Ms. Anderson. Is there, we have other people from public health. I might have mistaken whether you were going to testify or not. So Corrine, did you want to testify, or Mayfay?
Yes, Speaker, I would.
State your name and position again for the record. Thank you.
Yes. Good morning. My name is Corrine Bendicho, and I am currently the Acting Human Service Program Administrator at Bosa at this time. Buenas and Holiday, Honorable Speaker Therese Terlaje, Senators, community partners and stakeholders, and the Committee on Health, Land, Justice, and Culture. Thank you for the invitation to attend this virtual public hearing on behalf of the Department of Public Health and Social Services relative to financial resources, healthcare, and legal assistance for foster care parents. Again, my name is Corrine Bendicho. I was temporarily appointed to this position by Director Art San Augustine since June of this year. And I am one of the team of 7 DYA employees initially reassigned by DYA Director Melanie Brennan to assist with the CPS state of emergency declaration back in January of this year by Governor Lulu Young Guerrero. Before proceeding any further, I'd like to thank you all for the opportunity to submit my testimony in support of the passage of Bill number 4136 relative to expediting social studies and reports for adoptions. My recent reassignment to Bosa has been quite an eye-opener, as it has allowed me to witness firsthand the challenges that social workers in the Bureau have dealt with for many years, most especially the lack of adequate staffing levels in all sections. For purposes of this bill, I will focus primarily on the Home Evaluation and Placement Services section, or HEPS, which is comprised of the Adoption and Custody Home Study Services, as well as the Licensing Certification Unit for Child Care Facilities, Family Foster Homes, and Foster Care in general. They are the sole section responsible for conducting social studies and adoption custody reports ordered by the Superior Court of Guam. With only 2 social workers tasked out of current staffing of 5 total, to include the social service supervisor 1, this responsibility has been overwhelming. Guam administrative rules and regulations set a 45-day period to submit completed home studies unless specified in the court order. We are grateful that judges have used their discretionary authority to allow 60-day submission of reports. I believe that the passage of Bill number 4136 will definitely assist us as we continue to work toward onboarding additional social workers to fill critical vacancies in HEPS. I support the language and amendment in the bill as it allows qualified private contractors, personnel from other divisions or agencies, or qualified retired personnel of the division to step in and assist with this very important and critical mandate. One of the most effective tools afforded to us during this CPS emergency declaration was our unlimited access to the cohort of CPS retirees. Even until today, these retirees continue to volunteer their time and provide much needed assistance, guidance, and support. I am very confident that they will be assets if the need arises to contract additional support to ensure that the Bureau is able to keep up with its mandate to conduct timely social study reports for adoption and custody cases. In closing, I would like to just say that in order for the Bureau to continue to administer various child welfare programs designed to protect children and strengthen families, then we will need your continued support to introduce bills similar to Bill 4136 that are not only in the best interest of the children and families we serve, but that better enables us to successfully fulfill our mission. I stand in full support of Bill 4136 as it proffers support specifically to the home evaluation placement section of the Bureau as we navigate our way out of this emergency declaration described in the Executive Order 2021-02. Thank you.
Thank you very much. And if you could please submit your testimony in writing, that would be very helpful when you can. Thank
Will
you.
do. Thank you, Senator.
Thank you for being the acting administrator there in that very hard, difficult position. May Faye, did you also want to testify?
Yes, I do. Are you able to hear me?
Yes, please state your name and position again for the record. Thank you.
My name is Mayfae Moiko, and I am the Social Services Supervisor for the Home Evaluation Placement Service section here at the Bureau of Social Services Administration. Buenas and am I ready? Buenas and Hafa Day, Honorable Speaker Therese M. Terlaje and the Committee on Health, Land, Justice, and Culture. Thank you for the invitation to attend this virtual public hearing and informational briefing on behalf of the Department of Public Health and Social Services relative to financial resources, healthcare, and legal assistance for foster care parents. My name is Mayfae Moiko, and I am the Social Services Supervisor 1 for the Home Evaluation Placement Service section with the Bureau of Social Services Administration under the Division of Public Welfare with the Department of Public Health and Social Services. I thank you for the opportunity to submit my testimony in support of passage of Bill number 41-36 relative to expediting social studies and reports for adoption. As the supervisor for the HEPS unit, my responsibility is to ensure that all court-order adoptions and custody studies are assigned on a timely manner, as the department has a 45-day time limit to submit completed social studies for adoption and custody, unless otherwise specified in the court order. The court has been generous by giving Bosa 60 days to complete reports. Extensions may be requested by the department if necessary. HEPS also recruits licensed and monitors family foster homes, as well as licensed and monitored child care facilities. Currently, there are 3 social workers and 1 social services licensing officer. The licensing officer is in charge of monitoring and licensing child care facility in the HEPS unit. The primary duties of 2 of the social workers are completing adoption and custody study, and 1 social worker as the foster family licensing social worker to license all our foster homes. For most of 2021, the HEPS unit only had 2 social workers, and I took it upon myself to also take on cases to meet court deadlines. On September 2021, HEPS acquired 1 new social worker with experience in the HEPS unit. So now I have the 3 social workers and the 1 social services licensing officer. Adoption and custody studies are intensive, and it ensures that children are placed with a family that can best meet his or her needs, and to also determine what is in the child's best interest. The HEPS unit is designated to provide adoption services locally. Adoption services can generally be defined as optional means and alternative for children who do not have the opportunity for a permanent home and familial relationship with their natural parents, and were in stable, nurturing, permanent family ties can best be established through legalized adoption. I believe that the passage of Bill number 4136 will definitely assist Bosa. I support the language and amendment in the bill as it allows qualified private contractors, personnel from the division or agency, or qualified retired personnel of the division to step in and assist with this very important and critical mandate. I thank you, Mayte.
Thank you very much. Is Tess here? Okay. I believe that's all that have signed up to testify on this bill. And I will now open it up for the panel. Senators, Senator Taitigui.
Thank you, Madam Chair. This question is to, I guess, Mayfe or Karine. With regards to the cost that may incur by using a private sector, it was said in a testimony earlier that the cost could be from $900 to $3,000. If public health conducts these social studies on their own, is there a cost to the individual families from public health?
Currently, there is no cost to do adoptions or custody studies. We are ordered by the court to conduct these studies, and we have deadlines.
Okay, thank you, Mayfe. And in case there's an overload and you have the ability, which this bill will allow you to utilize the private sector to do so, then funding is going to be required in order to do that additional funding, number one. Number two, in the event of a social studies report that's conducted, if one is done, let's say in the month of March, and but something is delayed, the process in another perspective, you know, like getting through the courts and stuff, and nothing is finalized until like August. Does another study have to be conducted? Does it have a time, you know, does it die after a certain amount of time, or any changes?
No, so what happens is Bosa will receive a court order, custody or adoption studies from the court. They give us a deadline. Suppose I receive a court order for an adoption study today, filed by the court on October 6th, and it's brought to my attention on October 7th. From that day, the court would normally give me 60 days. In the court order, it'll say that the report needs to be submitted by December 7th. And the judges have been very generous. If we're not able to complete the court or custody study by December 7th, we would have to write them for an extension. But for the year 2021, we have, we have completed, we have beat those extensions. We've done a really good job, to also include me doing some of the work itself. And what happens is there's normally a court hearing after, like a few weeks after our submitted report regarding the adoption or custody study.
I see. Well, that's congratulations to be able to meet those deadlines. I really,
we're trying.
Yeah, good work on you, because this. So other than that, that's all the questions I have. I thank so much for public health and all the hard work they're doing to try and meet those deadlines. I appreciate it. But this bill, I think I support this legislation because it adds that another opportunity in the event that you're overwhelmed, and like most government agencies are sometimes very much overwhelmed. This gives you an avenue. So I appreciate the time. Thank you, Madam Chair.
Thank you, Senator Taitigui. Senator Torres, you're recognized.
I don't have any questions. I think the testimony was very thorough, provided by Department of Public Health and also by Lori Bosa and Tracy Anderson. So in the interest of time, I just want to thank everyone for the very informative testimony today. Si Dios ma'asi.
Si Dios ma'asi, Senator, I appreciate your consideration of the time. Senator Brown, you are recognized.
Thank you very much, Madam Chair. I also am supportive of the legislation and certainly the opportunity to expand the resource pool to be able to address these type of reviews and inspections so that we can help facilitate placing these children in safe homes during the time of need. So I support the legislation. Hope you'll consider us as your co-sponsors. With that, also thank you to everyone who's testified on this legislation. Thank you, Madam Chair.
Thank you, Senator Brown. I believe that concludes the testimony on this bill. I will continue to accept testimony for 10 days on this bill and ask that you submit it to the Guam Congress building or to my email at senatorterlajeguam@gmail.com. I want to thank everyone who's been present today to testify and for your assistance in pointing out very specifics and suggestions to improve the legislation. We're going to move on now to the hearing on Bill number 179-36 LS. This bill sponsored by Senators Terlaje, Sabina Flores Perez, Joanne Brown, and Therese M. Terlaje. I'd like to invite the sponsor to introduce the legislation. Senator Taitegui, you're recognized.
Sejus Masin Hafaday, Madam Chair. Thank you for scheduling this public hearing on Bill 179-36 and for the opportunity to briefly introduce the measure. You know, Madam Chair, I'd like to take this opportunity to thank you for addressing what clearly was a wrong decision by the Committee on Rules to initially refer Bill 179-36 to a different committee and for ensuring the proposal is appropriately referred to the Health Committee. You know, Madam Chair, to ensure we enact policy that has the necessary staying power, Bill 179-36 codifies, and I, highlight in that is codified in the Guam Code Annotated, specifically Article 5 of Chapter 13, which is basically the new Infant Safe Haven Act, and Chapter 13 with Child Protective Act Division 1. Also, persons and personal relations, Title 19, Personal Relations, and a requirement for the Department of Public Health and Social Services to adopt interim rules and other requirements for licensures of adoption agencies. Considering the actions of the 36 Guam legislature and the governor in their approval of a couple of measures a few months ago, which recognized the involvement of independent adoption agencies in the process for finding homes for our most vulnerable citizens, Bill 179-36 ensures that a set of rules and regulations is adopted pursuant to a transparent rulemaking process mandated by the Administrative Adjudication Act. Madam Chair, interim rules are also required, which shall be exempt from the provisions of the AAA process, because the legislature's decision a few sessions ago to authorize independent adoption agencies to operate without such rules and regulations in place. And as a local media organization summarized it as puts the cart before the carabao. Madam Chair, Bill 179-36 recognizes that despite serious concerns raised by the public health officials in June of 2021, and prior to the passage of legislation authorizing independent adoption agencies to take physical custody of an infant, Guam remains without a set of rules and regulations for licensing these organizations. Without rules and regulations in place, our children may be susceptible to criminal activity, including human trafficking, which we know has happened in Haiti and in a community much closer to home, the Marshall Islands. Madam Chair, without Bill 179-36, the only requirement to become an adoption agency is to obtain a business license, which simply involves picking up a license at Rev and Tax, no background checks, no standards or guidelines. In closing, Madam Chair, contrary to statements about Bill 179-36, not providing a transparent rulemaking process for the development of interim rules and regs, I beg to differ. And I argue that without this measure, we as legislative body will continue the reckless precedent set just a few months ago, where a majority of senators and the governor allowed adoption agencies to operate without any form of rules and regulations and requirements. Requiring Public Health to develop interim rules and regulations as quickly as it can is absolutely necessary, because the alternative, a situation in which no set of rules exist or where rules are developed on the fly, is not transparent. It threatens the safety of our most vulnerable citizens. I look forward to the comments and questions regarding this measure, and will work closely with your committee to make amendments that will help move Bill 179-36 forward, including the possibility of extending the proposed March 1st, 2020 deadline to a month or a couple of months thereafter, ensuring public health has the time necessary to complete the rulemaking process, and requiring the agency to submit a copy to the legislature of the interim rules, which shall be available for public review for a period of no less than 30 days prior to becoming effective. These are a couple of the amendments that I propose for this legislation. Madam Chair, Bill 179, we have an opportunity to finally focus on crafting sensible and strong licensure regulations for adoption agencies that want to operate, and to ultimately help prevent potential exploitation of fraud of our own children. Sijus Masi, Madam Chair, for the opportunity.
Sijus Masi, Senator Taitigui. We've signed up to testify the Deputy Director of Public Health, Mr. Terry Uggan. Please proceed, and if please proceed.
Thank you, Speaker, and thank you, Senator Terlaje, for this this bill. And if you don't mind, I just need to take a moment and clarify. Did you say there were amendments to your original bill?
A couple of amendments that I'm proposing. One, we may have to extend from the time that we met in my office, yourself, May Fay, as well as the governor's representative, along with several senators. We thought that March would be a good time frame, but that was during a time when the bill would have been introduced because of the delay of the bill being referred to another committee. There's been some time lapsing in that. So my suggestion may be a month further, like maybe April 1st, to provide a month or where you feel necessary. The other one is just an amendment to allow these interim rules and regulations to be publicized before enacted for no less than 30 days through the legislative website, or just proffered out to the public to review before the interim rules begin. Those are the only two amendments that I have so far.
Okay. And I question that into detail only because, you know, any amendment, we'd like to, of course, have the time to discuss that with all management here. And I know we prepared testimony, but the testimony was based on the information that we had before us. So, Speaker, are we awarded the opportunity to have this discussion? Of course, I can have this discussion with my director as well before we actually provide testimony.
Yes, please. There have been no amendments made to the bill at this time. These are being discussed here at the public hearing, and the committee will make amendments after this public hearing, if it's going to do so. Yes.
Okay, all right, I appreciate that.
On the floor, yes. So please proceed if you have testimony on the bill as is.
Okay, yeah, I will go ahead and proceed and move forward. All right. Buenas and Hafa Senator Terlaje, Senator Sabina Flores Perez, Senator Joanne Brown, and Honorable Speaker Therese Terlaje on the Committee of Health, Land, Justice, and Culture. Thank you for the opportunity to participate in this virtual public hearing and the opportunity to provide my testimony regarding Bill number 179-36, and that to add a new subsection 13510 to Article 5, Chapter 13, Title 19, WOM Code annotated, relative to requiring rules and regulations for the licensure of adoption agencies. My name is Terry Uggan, Deputy Director for the Department of Public Health and Social Services, overseeing the Division of Public Welfare and the Division of Senior Citizens, and in support of the department's efforts to mitigate the COVID-19 pandemic. The need to protect Guam's children is the responsibility of our community, our policymakers, and most importantly, the families of these children. However, in the absence of parents or extended family It is our community, with the assistance of policymakers, moral responsibility to protect the well-being of our children. The placement of an infant, child, or youth in an adoptive, loving, and nurturing home is critical to the development of the child's health and social well-being. Developing and implementing rules and regulations need to safeguard these values is critical and therefore need to be in place to better partner with and supportive licensing independent adoption agencies. Bill number 179-36 recognizes the need to have in place these rules and regulations for licensing of adoption agencies by March 1st, 2022. However, it also expresses the urgency to have in place the department's interim rules and other licensure requirements, which will ensure the health, safety, and welfare of clients. These interim rules and licensing requirements shall remain in place until the sooner of March 1st, 2022, or the adoption of rules pursuant to the Administrative Act. Currently, the Bureau of Social Services Administration Home Evaluation Placement Service Section Unit is in partnership with Region 9 Capacity Building Center for States and Territories. This agency's purpose is to enhance, expand, and develop services, practices, and policies for child welfare agencies to improve outcomes for children. Although Bosa has been in partnership with Capacity Building Center for States for over 4 years, recently they are now providing technical assistance relative to the licensing of adoption agencies. With the guidance of Region 9 Capacity Building Center for States and Territories, the Department of Public Health and Social Services is moving forward with the development of the rules and regulations that will define the process for an adoption agency to be established here on Guam. With careful review of Bill number 179, I find that this bill supports the process of licensing independent adoption agencies that intend to do business on Guam. However, at this time, the Department of Public Health and Social Services is not in favor of this bill. We will continue to work with our capacity partner teams from Region 9, and we will go forward with the process. Thank you.
Madam Chair, could we get a copy, please, of Terry, can you post that, please, on the chat, your testimony?
Absolutely.
I didn't get a copy of your testimony.
Absolutely.
And it's so difficult to kind of hear maybe everyone else who, I don't know if everyone's having the same issue, trying to hear each other. It'd be very helpful. I could read it. Thank you.
And I apologize for that. I think it's been an issue here all morning long when it comes to how well we hear on this. But thank you.
Thank you, Deputy Director. We also have, we have written testimony from Lori Boss, Tracy Anderson, and Kelly Larson, Directors of Valhalla Adoptions. Just one second. We have also signed up, Tracy Anderson, were you going to give testimony this morning? Or she's not here any longer?
I'm here, but Lori is planning on giving testimony today. Thank you, Senator.
Please proceed, Lori.
Thank you. Madam Speaker, Senator Taitagui, our other senators and committee members, thank you for having us today to present testimony. We at Valhalla Adoptions believe that establishing a set of rules and regulations to govern the licensing of independent adoption agencies should be fair and transparent. Agencies are not legal entities in and of themselves and are subject to the courts and laws of the land. There are laws in place currently to facilitate the placement of children for adoption on Guam, but there are no set business standards on Guam to help in creating that agency. We had quite the challenge. When forming our agency, we reached out to consult with several reputable U.S. agency founders and administrators for direction. We submitted our own background checks on ourselves just because it was something that was required in the states. We reviewed many states and territories' best practice guidelines for domestic adoptions in determining what would be most appropriate for Guam. Adoption is not a new concept to our island cultures, but all of the information that we gathered influenced the basic foundation of our agency standards. While we support rules and regulations for licensure, there are some points we would like to address in Bill 179-36. More positive language should be used in these conversations in order to promote education and awareness in the community instead of instilling fear. Ohala Adoptions is solely a domestic agency. There are very distinct differences in rules and regulations for forming a domestic agency as opposed to an international adoption agency. When the new licensing guidelines are set in place, differentiation needs to be made regarding domestic agencies and international agencies, because others in the future may form an international agency, which would require strict compliance to other regulations, most importantly, the Hague Convention. In reference to subsection 135.10, where it states that agencies will be licensed under DPHSS, we request that there be oversight established from other independent objective sources. DPHSS has stated clearly that adoption is not a priority for them, and they have not completed an adoption since 2017. We would like complete transparency in this process and do not agree that DPHSS should be exempt from the provisions of the Administrative Adjudication Act as stated in this bill, without a public hearing of their interim rules. Nowhere does Bill 179 mandate a hearing or public input of these interim rules. While DPHSS will be the expected licensing body, ensuring a public hearing of the rules and regulations, whether they are interim or not, allows all entities to provide input and come away with well-balanced guidelines for the safety of the island's children. We will willingly comply with rules and regulations set for licensure and have a desire to help any child who cannot be reunified with their birth family in a timely manner to be placed in a safe and permanent home. We urge the committee to incorporate more transparency in Bill 179. This can be done by adding language that was recommended in other recently introduced legislation. Thank you so much for your time.
Thank you very much, Ms. Boss. I think I don't have anyone else signed up except Public Health. Did you also want to testify, Corinne Bendicho and Mayfei?
Speaker, this time I'm just going to yield to the Deputy Director Uggan's position at this time. I'm also raising some concerns of questions that I guess were just told to us right now. So I would like the opportunity to discuss more with regard to that.
All right, Mayfei.
I also defer as well.
All right, thank you. Ms. Taylor, did you want to present testimony? Thank you for being here this morning and thank you for all the work of Harvest House. Is there anyone else who would like to present testimony? If not, I'm going to open it to the panel. So we'll begin with Senator Taitigui. Would you like to begin?
I'll save it to the last, Madam Chair. Thank you. On my close.
You're recognized.
Madam Chair, I said I'll wait until the end. I'll allow my colleagues to go first.
I'm sorry, I responded with thank you. And Senator Torres, you are recognized.
Madam Chair, I don't have any questions. Again, I appreciate the testimony and the perspective that was brought by Public Health and also by Ohala. The working with Region 9 is a very positive move forward, and I think that that just shows your commitment to addressing those concerns that you had when the whole issue about regulation of adoption agencies and having true oversight and audit of them was raised previously in other legislation. So I just think that you've demonstrated a good grasp of your responsibilities to the public and to the children of Guam. So I just want to thank you, Mr. Uggan, for that testimony, because it was quite appreciated.
Thank you, Senator.
Thank you, Senator. Senator Brown, you are recognized.
Thank you very much, Madam Speaker. I do want to ask because, I did participate in that meeting that we did have with Public Health and the representative from the governor's office with regards to the draft language that was placed in this bill. The only feedback we had gotten back at that time was they just wanted modifications to the introductory part, the legislative findings and intent, which I understand that the main sponsor has since amended. So I just want to clarify because I'm a little bit confused. I mean, I have no problem with regards to transparency. I'm quite an advocate of that. I understand that the interim rules were simply to allow a process of legislation that was passed a few months ago. That while we raised this issue repeatedly on the floor of the legislature, the main sponsor who's participating in this hearing this morning refused to address an amendment that would have allowed the appropriate authorities to move forward to put these regulations in place. I hear from the adoption agencies that they are open to that. They're requesting it so that it allows even playing field, not just for OHALA as the current adoption agency here on the island, but certainly any future organization that wants to come forth to do adoptions. I mean, our objective is to want to make sure that these standards are in place because we've already allowed this to happen with no standards in place over the last few months. This can be amended to include the AAA process. Certainly it'll take a few more months, but that's fine as well to get it in place. So I just wanted to ask our deputy from Public Health, did I miss something with regards to that engagement, that discussion with regards to putting forth these regulations, because essentially it's really leaving it up to Public Health to put forward their proposal on how you think best to structure the standards for adoption agencies in general. I know right now we're talking with OHALA who's testified, but of course we need to look at the picture that this could be any organization coming forth to want to create an adoption agency. So I wanted to get some feedback from the deputy with regards to that.
Sure, absolutely, Senator Joanne Brown. And you raise a good question, and the Department of Public Health and Social Services stands eager to make sure that we have in place strong rules and regulations to help define the process for the licensing of agencies, adoption agencies, to do business on Guam. That part's a given. And we're all big about the component of being transparent. What we're looking at, though, is we want to continue to move forward with our Region 9 partners. We, at this time, don't want to lock ourselves into this. Not that we wouldn't consider this or something similar to this at a very soon later date, but as it is right now, the Department of Public Health and Social Services is not in favor of it. I know we did have the discussion. It's already been a few weeks ago now, and the idea is to be looking at interim rules and regulations to give guidance. And we do know that from those interim rules and regulations, that will be the foundation for a lot of the actual rules and regulations that we finalize and have in place with that March 1st, 2022 deadline. But we are looking at timeframes. We will continue to do our partnership with Region 9. And we will continue to advocate for having that transparency and making sure that our community doesn't just get buy-in when it's presented, but a level of buy-in throughout the process. And I think that even heightens transparency even more.
So with regards to this, so if any other legislation is proposed to require you to do rules and regs, is this going to be the official response? Is that Public Health is waiting to work with Region 9 to come up with this proposal? Because Public Health can and should at any time be able to submit rules and regulations for review through the AAA process with regards to this. Is that something that you're looking at? Is Public Health looking at doing that on its own initiative with regards to whoever it is you're consulting with this process? I mean, what can we anticipate? I think you understand quite clearly that we want to see standards put in place. So how are we going to facilitate that best if you're not open to legislation mandating it? Because we're concerned about the time frame too. We don't want this issue to sit any longer than it already has. And we're deferring to the expertise of Public Health. I mean, this is not something new in other jurisdictions. There are standards in place that regulate adoption agencies within respective states. And so that is something we would like to see, but we're deferring to your expertise to put what those standards should be in place, rather than us saying, oh, we're copying some other state and here they are. So where can we go from here to help facilitate? Because I think we all have collectively the same agenda, the same desire for the same outcome. Perhaps vehicle to get there. So can we get clarification with that? Because I'm a little confused.
Sure, absolutely. And to begin with, we're not just waiting to work with Region 9. We are already engaged in Region 9, and we have been so for the last 4 years. It's just the topic that we're discussing now, of course, has to do with the guidelines around adoption and the licensing of those agencies to do business here on Guam. At any time, by all means, you are welcome to join in on those TA conversations as we move through the process. But if that helps give guidance as to what exactly we're going through, we are looking at other states, that is true, and we are not going to cut and paste. But I will say this, and looking at other states, it has really opened up my eyes personally as to just exactly the process. I don't want to say nothing short of hurdles that are out there, but that people have to go through, these safeguards that are out there. And so it really is getting into more detail for that. We realize that time is a concern and that we will be standing up interim rules and regulations. That part is a given. And we are willing to work with legislation. We just want to work with it in the means of having that transparency, which I know was mentioned, but we want to heighten that. And just, in my opinion, I want to make sure that that the community of Guam is woven into just the process, not at the end, but throughout the process. Just as I'm inviting you, if you'd like to sit in on the TA calls with our Region 9 representatives, you're welcome to do so, or anybody else that's on this call. I do extend that invitation. So I hope that does give clarity. It doesn't mean that public health does not want rules and regulations, interim rules and regulations in the meantime. We do. We're just moving forward as we continue to work with our Region 9 representatives, and we're reaching out to make sure that we have a very strong component of transparency here on our island. A lot of community feedback that I've had has to do with the fact that although there are a number of people that are not vocal here on this island, but they are concerned about the fact that Guam's children, which so normally stay here on the island for the most part, that we're opening ourselves up to having not just one party, but perhaps several parties that may come to Guam and wanting to set up an adoption agency. So we do want these guidelines to be as efficient and as clean as possible. Not saying that they wouldn't be. We are engaged in wanting to make sure that there is interim rules and regulations in place. We're not saying that we're not. We're just simply saying that at this time, we're not supporting this bill. And with that, it gives me an opportunity to discuss some of the amendments that may be coming down the pipeline with my management as well.
Terry, do you have a time frame that you're looking at getting this process in place? I mean, the legislature can mandate the rules and regulations, and I mean, the AAA process is there for rules and regulations throughout the government of Guam. I don't think this has to be unique to that. But what are we going to expect in return? Because obviously this has been a concern that has been addressed. The legislature through majority vote has already put in place the authorization that allows adoption agencies to literally be at the table while you guys are deciding the fate of where these children are going to go. That's already there without regulation. So understanding, we have a sense of urgency in wanting to see some standard put in place. You're just simply by the draft of this legislation being given the latitude to do that in the interim. But if you don't want that, then what can we get in return as a public to expect, and certainly as the legislators? What time frame can we expect some structure to be put in place so that our community has some comfort level that any adoption agency here on Guam has standards to meet that protect the community and also protect the adoption agencies as well, because then they know what the benchmarks are that they need to meet with regards to their operations to ensure that, the people that are working there have guidelines and standards that they need to meet so that there's some comfort level. Because right now, there's not a lot of comfort level.
Okay.
We didn't create the situation, at least not by my vote, but that's a situation that we're in right now.
And Senator, I agree. It is the situation that we're in right now. If we're just looking at a timeline, I can give you a timeline, but realistically, we continue to partner with our Region 9 representatives. We continue to work and move forward with that. They have carved out, and we were told that they're going to provide us with additional technical assistance and an additional person actually whose expertise area is in the arena of adoption policies and rules and regulations. And from that meeting that we are going to be having with them, we can work out a guideline for you or a time frame for you. We are very much concerned about the well-being and placement of children. That very much is Protective Services business and our line of work. And we are very much concerned about agencies coming into our island. We just want to make sure that we have a good relationship with them, clarity, and we understand their processes as well, and their vision for that matter. But as far as this bill is, as it is, we're just saying that we are not in favor of it at this time. I do know that Senator Tello did mention the possibility of making amendments to it. And all we're asking is to be able to have that opportunity to see that product.
Again, Terry, you and I have known each other for a long time. I'm a little lost. I mean, perhaps because really all it's asking is for public health to do interim rules and regulations just because of the original law that was passed and put in place. Understand, as we met, we have that sense of urgency because right now there is nothing out there. It's a blank slate. There's nothing out there. And so, I mean, you are saying public health doesn't want the ability through this legislation to create interim rules. You're going to do your own separate thing on your own separate time with Region 9, and at some point we're going to hear what those recommendations are. Am I understanding that clearly?
You know, and Senator, yes, we've known each other for a very long time. And all I asked was if there is going to be amendments to this bill, this proposal, that we at least be able to understand those amendments that they're looking at to make to Bill 179. It feels like there's an urgency to make a decision about this bill today, simply based on what is present without the amendments. And we ask that we be able to see more of the final product. If there's going to be amendments to this bill, let us look at those amendments. If it's going to be scheduled for next week, we will do it next week. We too have a level of urgency regarding the placement of children. We go to work with it, we go home with it. I mean, it's the thing that we think of through the night. But just as I need to move forward cautiously, I need to have those discussions with my team as well. And perhaps it's a matter of just letting us know exactly what these amendments are going to be, instead of asking us to go ahead and make a decision here and now, because we clearly are reaching out and saying, let us know what they are. If you want to schedule something very quickly to assure the community, we will. It's just allowing us to have that discussion.
Yeah, I mean, we're just giving you the opportunity as public health to come up with these regulations. We're not mandating or telling you what these regulations are, because we're deferring to public health's expertise to set those standards. I understand what you're saying. You need perhaps additional time to do it. But I mean, that's really what this bill does. Irrelevant of the bill, I mean, I think we're very clear what it is we need right now. And again, we just want a reasonable time, because I'm assuming any other bill that comes up with regards to requiring any rules and regulations, you're going to have the same response to that. I'm going to assume that on your statements today, but I just want to make sure this issue does not get lost, because we do. And it's not a circumstance we wish we were in. We wish that before the other legislation got passed a few months ago, that these requirements were put in place so that, again, we have some comfort level that there's standards, because right now there are no standards. I mean, I appreciate the fact that OHALA has come to testify, and they've come and met with me as well directly to discuss these issues. And they're saying, yes, we also want regulations. So we know what the playing field is of what we're expected to do. So we know what our standards are that we're going to be held to. So I think that's all good. Nobody's disagreeing about that. But we would like to know that. And certainly if there's any amendments to be made to this bill or any bill related to these issues, obviously we would want your input and your direction, because where we're at right now is not a good place. We want to be in a better place with regards to these issues moving forward. So that's my concern. That's where we're at. I'm sure we have no problem participating in these meetings and having those discussions. But I think we have an expectation within the near future that we have some standard in place, and simply rules and regulations allow that mechanism for those standards to be recognized and go through the legal process And that's really what this is all about. How the specifics are, we're deferring to your expertise, as I mentioned, to define what that should be. We're not in a best position to do that, and we're certainly deferring to public health to assist us as a community define that for the interest of everyone involved here. And that's really what it comes down to.
Yes. Thank you, Senator. And I do echo that as well. You know, it really is expertise, not just public health, but collectively, you know, even parents of young children of all ages, for that matter, you know, are experts to a level of degree. And the idea is really to make sure that we definitely have that transparency, that we have those buy-ins from those family experts that are out there as well, and then giving them that opportunity to speak up and talk about, again, you know, one of our most vulnerable populations. Not just a child, but a child that was removed for the purpose of not going back to a parent. And that's a very special and very unique group of people. So by all means, you know, we talk about timeframes. We need to be talking about, well, what's the time frame for whatever changes or amendments that may be taking place for 179, and how can we move forward, you know, collectively. If there are other bills that may come up along the way, I would like to think that senators will partner and share the vision, because clearly it is about not about us and them, it's about the community of Guam as a whole. And we really would appreciate having that expertise, that community expertise buy-in as well.
Well, like I said, I have no issue with regards to transparency. I assume that the interim was simply to allow something to be put in place where there's such a tremendous void right now. And I hope we hear back soon, because again, I don't think we have the luxury of allowing things to proceed without these standards being put in place. So with that, Madam Chair, thank you very much for the opportunity to provide question and comment with regards to this bill. Thank you.
Thank you, Senator Brown. I also have questions. Senator Taitui, shall I proceed? And you still want to go last? All right. So yes, so Deputy Director, thank you all for your testimony, first of all, and suggestions for the bill. I'm glad you're working with Region 9 and have seen the safeguards in the other states. It's my understanding that the bill before us does three things. One is very explicitly requires that adoption agencies shall be licensed by the Department of Public Health and Social Services, to remove any doubt that it is going to be your department. Second of all, the bill sets a deadline on you, the Department of Public Health and Social Services, of March 1, 2022 for your permanent rules or for your regular rules as to how you are going to license these adoption agencies. And that adoption of rules is going to be pursuant to the Administrative Adjudication Act, which of course requires public hearings by public health. And again, public hearings when it comes through the legislature. So rules pursuant to the Administrative Adjudication Act will have public hearings, right? But this bill also does something which I agree is urgent, and that is it allows public health. It doesn't mandate, but it allows, well, it says it shall adopt interim rules and other licensure requirements, which shall be exempt from the provisions of the Administrative Adjudication Act. As you know, the Administrative Adjudication Act requires certain timeframes to be followed. And I understand your objection to the bill because you want public hearings, and there's nothing to prevent the Department of Public Health from having public hearings, even if it is exempt from the Administrative Adjudication Act. The issue for me is how urgent is this, right? As was stated earlier, we have in place right now laws that allow adoption agencies to determine placements, to help you to determine placements, to do other things in the adoption process. And I want to know how comfortable is public health right now without any rules. And so how urgent is it to have interim rules? First of all, can you get your permanent rules done faster than March 1, 2022? And second of all, how comfortable are you without any interim rules?
So Senator, both are very good questions. And public health, of course, is very uncomfortable having no rules at all, interim or otherwise. So, but we clearly want to move forward and have that in place. We've never said that we didn't want them. We clearly do want them. However, all we asked for was that opportunity to have more community buy-in, and that was it. It is one of those situations where we know that it's significant. We know it's important. I know Senator Joanne Brown wants a time frame or timeline to be given. I'm sure we can provide that to her, and we can work with Region 9. I get the feeling that, of course, there's a level of urgency behind the interim rules and regulations, and there should be. I wouldn't expect anything less. That urgency is on public health side as well. We are concerned when people in the community call into us and say, well, I heard of a child that's available or whatever the case may be. Granted, for a number of years, we have all types of situations all around Guam, whether it's in Saipan or whether it's in the Marshall Islands. I mean, we're aware of situations that involve compromising situations for children. So we definitely are in favor of those rules and regulations to be in place. All that we were asking for really was to get a better idea as to if there are amendments to this bill, that we be able to see that and to be able to have a strong component that supports community buy-in and not necessarily a public hearing at the very end of this, but something that's woven into the process itself. And you know, as you stated, well, public health then can have its own, I guess, town hall meeting type and get buy-in. And, you know, we're going to visit that and see what that process even looks like, because maybe that's an option on the table. But the decisions made at the Department of Public Health need to be in the best interest of children, and they also need to have community support. And we are just trying to reach and have more of that community support.
I understand that, but we're talking about a situation right now where there may be no rules in place. So I want, my concern is whether, you know, I think this bill was intended to give public health the ability to monitor those adoptions right now, as without any rules. Not sure how you're going to be able to do what you are already seeing with your research with Region 9 and the other states, how you're going to enforce safeguards. For example, so I tried to get a handle on what adoptions have occurred in the past year, and I've requested information from the court on the number of adoption cases filed, the number of adoption cases granted, the number of terminations of parental rights that have been filed and granted, the number of adoption cases that had home studies, and who administered those home studies, the number of adoption cases where at least 1 year of home study post-adoption was not required, as in the new law. I wanted to know of any, you know, the courts had granted any of those. And my understanding is that public health does not have this information at this time and is not able to truly monitor. And so I also wanted to know, I didn't ask this of the court, but I would like to ask of public health. For example, do you know how many children who have been adopted in the past few months have left the island? Or, you know, are there any? And are you able to monitor those? Are you even notified of all the adoptions that have occurred? And those are the types of safeguards that occur in other jurisdictions that, you know, I think public health wants, but I can't, I just, I guess I'm also surprised about, you know, it's either urgent or it's not. And so if you're going to follow the regular timeframes of the Administrative Adjudication Act, then I think we're looking, you know, that's fine for regular rules. But if you need rules in an emergency situation, in an interim, we're trying to cut down timeframes, not necessarily cut down public input. There are ways to do that if you are sincere about wanting public input, but we can do it on an expedited basis. And I think that's what I would hope that public health would have wanted, in its own pursuit of, going forward, that it would have wanted that. I'd like to ask, well, I'm just going to leave it at that, but those are my concerns. So we have a situation right now where there are no rules, and we have a situation where, public health is going to be potentially mandated to put in rules, but in the interim, that we don't have that type of, control of the situation. All right, so Senator Taitigui, you're recognized.
Thank you, Madam Chair. I realize we have an engagement coming up soon, so I'm not going to belabor this any longer. But I do want to ask if Bethany wanted to say anything. I know she was listening intensely to some of the comments, and shaking your head on certain things that she agreed with, and I'm taking notes on that. But if there's anything you want to say, Bethany, I leave it to you.
Thank you, Madam Speaker and Senators and Public Health and.
Oh, I think, okay.
Paula here. I'm so sorry. Can you guys hear me?
Okay, now we can. Yeah, you broke it up there.
A foster parent for 13 years and taking in 40 foster children. I just come from a different perspective, but just listening in and wanting to adopt these interim rules, I strongly encourage that listening in and hearing the statement that we have been working with Region 9 for 4 years. I'm wondering what has come of the 4 years of already reaching out to Region 9. If we've already had a relationship with them. And I honestly don't know who Region 9 is, so that would be nice to know. But then to think about, again, the urgency of this. I work with 40, we have 50 licensed foster homes. I know CPS works with them and DPHSS works with them, but I also work with them on a daily basis. And I see the need firsthand as well of kids needing to be adopted and not kept into the system too long. All sorts of things that we need to work on. But with this in particular, I just see that there is an urgency for rules and regulations and transparency. I would love to hear the Senator, what you said about the adoption cases filed and all the findings that you just found out with asking the court on that. I would love that information. I think for transparency's sake, that is something the public should know of how many adoptions have happened, how many taking the legal rights of parents away, how many kids are being left off or going off island after permanency. But yes, in the emergency case of a biological mom just in a rough spot wanting to put her child up for adoption, there has to be choices, I do believe, on Guam, and we need the best adoption rules in place so that the protection and safety of our children and emergency situations, we don't want any child to have to wait 90 days or 60 days or a year, which most of our families have to wait a year. Or that's the minimum. Usually it's also like soonest is a year, but usually we're looking at, I'm looking right now at my foster children, like 4 years. So sometimes it takes 2 to 4 years of adoption. But I'm not for or against. I am for the interim rules. I am for the emergency situation that it is in, and I would also just really love to hear the transparency issues of findings that we have, that we all have done some research on and for the public to know so that we all can give our input on it. Thank you.
Thank you so much, Bethany. I greatly appreciate it. You know, earlier I was giving out kudos and just ranting and raving how well public health is doing with foster care, but it's unfortunately, I'm very disappointed when it comes to the adoption side of public health. And I'm not saying that because, Terry, you came and testified against this measure. To me, it's all about being able to put these rules and regulations in place for adoption agencies to come to Guam, to open up, to be legitimate. And it's been needed for quite some time. And for you to come to testify without any suggestions or amendments to the bill, it just makes me think that, okay, well, what changed? And Senator Brown brought that up, you know, specifically. What changed since the time that we spoke in my office on creating this? I mean, it's not just myself, but the public is screaming for the same thing, to ensure that our children on Guam are being handled by agencies or companies that come onto Guam as adoption agencies, that they're truly legitimate. And that's all we want. That's all this legislation is for. Nothing political about it, unless you make it political. And right now I'm seeing it's a bit going on that side. And, you know, shame on anybody who puts that before the children's safety on this island. You know, you have a conscience, Terry, and you've had one for many years that have given you that reputation of being a good, honest individual. So I hope that you today, and yes, there is an urgency. What stops somebody from coming on this island and opening a company here? You know, the legislation gives you the ability, it codifies you public health and gives you the option to create and implement rules and regulations, interim rules. And right now you don't have that authority. This bill will actually give you that authority to create these interim rules. Now, if you want transparency in the public, please let me know today. And then the committee on our committee chair will look at it, and if we'll put it in the legislation to make this happen. But Region 9, there was a question, Terry, I'll let you answer this, please. I'm sorry to linger on, Madam Chair, but there was a question twice by Bethany and then also by Terry Anderson. What is Region 9? Can you explain, Terry, for them to understand what a Region 9 is?
Sure, absolutely. You know, federal governments throughout the US and into the territories is divided up into different regions. And so simply that Region 9 is inclusive of Guam, American Samoa, states like California and so forth. And they have certain federal partners that are assigned to these different regions to provide technical assistance and guidance, grants management, an array of different services as it aligns with the federal government. And I will say, and thank you, Teller, and you know, at no means does public health say that these interim rules and regulations are not important. They are incredibly important. That part's a given. We have made recommendations as we sit here today, and that had to do with that transparency component that we'd like to have in place. I've reached out, I've said that anybody wants to sit in on the TA conversations with our Region 9 partners, our capacity building partners, to do so. We will share that link with you, and we will let our Region 9 partners have that heads up. We want to move forward. We want to have in place. We realize the urgency of it. No one realizes the urgency as much as Bureau of Social Services, Department of Public Health. It's just, we definitely want to lock in the community buy-in, that input, and to have that as part of the process. If it delays the process, apparently we need to move forward, but there are community people that are out there who are saying that, yes, would like to make recommendations as to what this is going to look at. And we just want to be able to capture that. And if we can capture it in the bill, all the better.
Okay, thank you, Terry, for that. And I look forward to hearing from you later on today with those changes, the speaker as well, to provide it certain changes you want to this legislation to move forward. And there was a timeline that was asked. If you're using Region 9, you really didn't give a timeline as to when you would have that completed with Region 9? Is it going to take you 6 months? I mean, you've been working with Region 9 for quite some time. You said you started already working with them on these rules and regs?
My point is that Region 9 is no stranger to Guam, and that we've had a relationship with the Capacity Building Center for States and Territories for 4 years now. Has all that time been about adoption rules and regulations? Obviously not. They've been other topics of concern. And that's part of their capacity building. It's part of their technical assistance. But the energy has been redirected now, and it's about trainings for foster parents. It's about enhancing supervisory skills. It's about avoiding burnout within the workplace. I mean, there's a whole array of different services for discussion with this team. And right now, the focus has been switched, and it is about the guidelines, rules, and regulations for adoptions. And they are helping us walk through the process of looking at different states that kind of fits our demographics or something similar to it. And it even includes a person who is actually running a licensed adoption agency in their state. And they too are an expert on the guidelines as they've helped develop those guidelines.
Terry, when did you start talking to Region 9 about the adoption rules and regs?
And I do have Mayfair, and I've got Cora on the line. If you want the more specific time frame as to when the conversation initiated, Mayfair, you're unmuted.
Hi, good morning. So I started working, or I informed Region 9 just 2 months ago that we need to start working after our meeting, that we need to start working on our rules and regulations for.
So have you, other than just telling them that you would like to talk to them 2 months ago, have they reached out anytime since that time? Or
Oh yeah, no, I've been working with Region 9 for a number of years, and
No,
every year.
The adoption, just for the adoption rules and regs.
I talked about that since I believe April is when I submitted what I want to work on for the year. So in the beginning of March, April, we write our needs to Region 9 to let them know this is what we want to work for the year. So I wanted to work on custody and adoption study even before this whole started. So that was my goal before.
But Mayfair, the question the senator is asking is what exchange have we had? And I can answer that too. Yes, we've met. We've actually already exchanged the guidelines for different states. We've been able to start critiquing those guidelines as to what would work on Guam and what makes sense for whatever state that those guidelines are taking place in. And then we will have next meetings. But there's already been exchanged what we'd almost call homework, where they give us certain states and we go through them and we really get a better idea as to what the different processes are in these particular areas and what those processes would look like for Guam. So the answer to that question is yes, there has been exchange of information and documentation, and that we have gone through a couple of different states' guidelines already, and we've submitted in that information or recommendations to our TA partner.
And what is the timeline, Terry, that you're hoping to finally come up with these rules and regulations with Region 9? What is your ideal timeline?
Well, the ideal time is as soon as possible, clearly.
Wrong question.
Because you're right, there are children that are out there and adoptions that are going on. And I will say this, and I will answer that, but I will say this. There's an array of children that get adopted here on island that public health doesn't even have purview of. These are the ones that are private adoptions that go through the court system. And so if somebody were to ask how many adoptions have taken place on Guam, literally the court would be an excellent resource for the purpose of private adoption. We track and monitor the cases that get referred over to us. Who refers them over to us? Primarily, it's either an attorney or it's a judge that gives us the clearance to get in and work with this family. So with that said, the courts, undoubtedly are a wonderful resource to find out how many of these children are still on island, what that process looked like, what the length of a time that the child was in the home, whether there was a monitoring period. Usually if there's a monitoring period, that's when they activate public health again, and we'll be part of that. But other than that, I think there's a little bit of a misunderstanding to think that public health is supposed to be on top of all this. it's great if we are, but the truth of the matter is, when it comes to adoption and the ones that come through public health, we are on top of. The ones that go through private attorneys, the one that goes through judges, we are not authorized to participate in that, not unless we are activated through an attorney who works through a judge, and then we have a role.
Okay, Terry, you didn't give me a timeline
Oh,
like
I'm
you're.
sorry. So,
Yeah,
so in addition to the need to have it as soon as possible, if I give you an exact time, it feels like I'm being held to that exact time, in which case I would be shooting literally into a bowl of jello. The truth of the matter is, as soon as possible, whether that's next week or next month, seriously, at this point, I don't know, but I simply don't know because I need to contact Region 9 and have those conversations. Else I'm obligating them to give us a timeframe deadline without even having their voice. This is, that example of having the voice brought to the table, the community's voice brought to the table, that level of expectation that there's a deadline without having that level of representation. So, I can contact them. I know it's their middle of the night, but I can contact them through text, and I can say, hey, what works for you guys? Because clearly there is a deadline that is being asked of, and we can provide something like that. But I'm sure on the federal side they're going to say, what, how is that possible? So, but it's on the top of our issue. We deal with this issue. We've had those conversations with our partners. I'm delighted that we have that partnership with the federal government. They are a strong resource. They too embed themselves into a lot of community-based organizations throughout the US and into the territories as well. So I think they're an excellent resource, but I think I need to reach out to them and at least get guidance from them as to the time frame that we would be looking at.
Terry, thank you so much for that. And that's to my point. I don't know how long that's going to take. Working with Region 9, it's quite some time, and that's what this bill does. It allows you, while you're working with Region 9 to come up with these guidelines and rules and regulations for adoption agencies opening up on Guam, you can create. This bill will allow you, and it gives you the ability to create interim rules and regulations. Like I said, you don't have that right now. And for the adoption agency that's already on Guam, I'm pretty sure that they want to be able to keep their reputation as a good, a standing business with all the guidelines, and to have another agency come in or another company come to Guam, open up, and they don't follow that same ethics as like this one here, it gives all adoption agencies a bad name, and nobody's going to trust them. And this is what we're trying to do, is just provide those rules and regulations so that honest individuals who open up these agencies are doing the right thing for our children and keeping them safe. So Terry, I look forward to several things. One is any kind of amendments that you would like to make to this legislation, because we're trying to get it on as soon as possible. To the guidelines from Region 9, I'm sure everybody wants to know about that. And lastly, what Bethany and several of us want to know are all the data and statistics surrounding adoptions. So that being said, Madam Chair, it's obvious that we're hoping to work with public health now again, which I thought we did when we sat down to create this bill, which was created with you, to move forward, and to answer some of these questions that we have. I know that Tracy Anderson also mentioned, that this is the first time they heard of Region 9. So Terry, you said you're going to put a text out to them today or tonight.
Yes, I'm sure I will. I'll make sure that I put it out there. I know that there are perhaps a lot of people that are not in the government that may not be familiar with Region 9. Right. By all means, take a moment, Google it, because it's a huge part of how business is done in every state and territory here.
It's very important, for them to know, because they're doing business here on Guam as well, so they need to know all the avenues or mechanisms that public health is going to look at incorporating. So again, thank you, Madam Chair, and thank you, Terry, Corina, Maythe, always a pleasure to see you as well, and to Tracy and Lori, thank you for your testimony and being here, Bethany, and I greatly appreciate the question that Senator Brown had proffered in this public hearing. Sijus Masi, be safe out there, everyone. Thank you.
Thank you.
Senator, again, this these bills this bill is very relevant, I believe urgent, because of public laws that have authorized independent adoption agencies duly licensed under Guam law to play key roles in the foster placement and adoption of children, which is traditionally the responsibility of social services or the department. And these authorizations were enacted prior to the adoption of any rules or regulations for the licensure of those independent adoption agencies. And so, of course, we look forward to your rules and regulations that you're working on and that will be promulgated under the administrative adjudication law in your partnership with Region 9. But as you said, it looks like that might take some time. And so in the interim, I am looking at public health for a solution, whereas the bill had authorized an expedited process. If you're going to go through the regular AAA process, then I would suggest that you just come up with your final rules and do that. And you put all your time and attention into that, because I don't think that they can wait. And if you're going to take the time to go through the entire AAA process, that has mandatory timeframes that you have to wait for comment and also. So yeah, that should be final if it's going to go through that process. So, that's what I'm saying. If you don't feel the need for some more expedited interim, I am concerned in the interim. All right, with that being said, we're going to close testimony on this bill. I will continue to accept testimony for 5 working days following this hearing. And you may submit testimonies to the mailroom of the Guam Legislature in the Guam Congress Building or through email at senatorterlajeguam@gmail.com. I want to thank you all again for your testimony today. It's 12:10 p.m. Thank you.
Thank you.
This hearing is adjourned.